Good evening. I now call the October 28th, 2020 meeting of the Charlotte-Mecklenburg Board of Education to order. I will now entertain a motion to adopt the agenda.
So moved. Second.
Okay, I hear a motion from Thelma Byers-Bailey, a second from Carol Sawyer. All those in favor, let it be known by a show of hands. Any opposed? Okay, Madam Clerk, the agenda is adopted by a unanimous vote of 9-0. Before we move into the agenda, I'm going to turn to the superintendent who requested a point of privilege.
Thank you, Madam Chair. Board members, I want to begin tonight by thanking those in our community, our CMS staff, yourselves as board members, and all members of our community who reached out and provided well wishes last week after I announced my diagnosis. I am thankful that mine is a condition that can be remedied by diet and medication. I appreciate all of the cards, the emails, the text messages, the voicemail messages. These kind and encouraging words have uplifted both my family and me. I hope to face this condition with strength, courage, and faith, and I would like us to use this experience as a reminder to all of our students, to all of our staff, our families, that it is very, very important that we take care of ourselves. And so I encourage every one of you to take the time to make your personal health a priority. Thank you, Madam Chair.
All right, thank you. So we now have some information items to go through. The first is I'm going to turn to our board vice chair, Thelma Byers-Bailey, to share some information regarding Behringer Academic Center.
Thank you, Madam Chair. At our last meeting, this board launched some significant work. We began making sure that the names of our schools reflect the values and our ideals. Renaming Vance was the first step in an important endeavor for our schools and our community. This endeavor is important for several reasons. Names and symbols matter. They reflect who we are and what we believe. Our country's painful, shameful history of racial injustice is the backdrop to this endeavor. It is a reminder that when we take a wrong turn, it's important to correct it, to reset our navigation so we're moving in the right direction. We want our schools, in their names as well as their instructional practices, to offer inspiration to every student. I believe we have several additional schools whose names should be evaluated to see if they are inspiring today. And one of these, which is in my district, is Behringer Academic Center. And there are others in my district and elsewhere that bear closer examination. We have an established process in board policy to look at our school names on an individual basis. That process includes input from the community, our students, and our staff. However, we do not have an established process to look at all CMS school names at one time. Consequently, the board and the superintendent are considering the development of such a process to look at all existing schools and determine if their names are appropriate for our community today. Some of them may not be, and any process the board creates must allow us to fix that. I know I speak for my colleagues when I say I hope that the process is created sooner rather than later. Certainly, our naming process works if our naming process works as it should, the school now known as Julius L. Chambers High School has a name that reflects our commitment to equity, to equal access, and to opportunity for all. I'm proud of the work we have begun, and I hope the community and our families will support us as we continue it.
Okay.
Thank you.
All right, thank you, Madam Vice Chair. So for the next two information items, I'm going to turn to the superintendent, the first being talking about the process of changing the name of Behringer Academic Center.
Thank you, Madam Chair. So tonight, I bring to the Board of Education the opportunity to begin the process of changing the name of Behringer Academic Center. As Chairwoman Dashew and others shared, when we began the process of changing the name of what will soon become known as Julius L. Chambers High School, and as Vice Chairwoman Ms. Byers-Bailey stated so well tonight, this is not just about changing a school's name. That's why our Board of Education and I chose to begin this process tonight in this public forum. This differs somewhat from previous school name changes, as the process to do so begins with a recommendation from the superintendent. However, we know it is about establishing a culture within our district that reflects inclusiveness and demonstrates that we will not tolerate racism, bigotry, or hate in any form. We will not allow the atrocities of the past to be celebrated in a way in the present or in any way in the present or the future. So a formal recommendation to begin the process of renaming Behringer Academic Center is forthcoming. This process will involve openness and transparency with input from the community, from students, alumni, present and past, faculty, and administrators and others. Principal range will engage key audiences immediately, and we have heard feedback from some in our community who want to be informed and involved. And I can assure you that is our intention as we move forward. Thank you, Madam Chair.
All right, thank you very much. Okay, next we're going to have an update on the requirement to do our testing in person. And I will turn back to you, Mr. Superintendent.
I'm just going to keep my microphone on, Madam Chair. Thank you again, Madam Chair. Our Chief Equity Officer, Dr. Frank Barnes, has an important update about required testing for our students enrolled in the Full Remote Academy. Our staff has worked diligently to develop the full remote option for our families, and many have taken advantage during this period of uncertainty caused by the pandemic. We have gotten feedback from our families after our recent announcement that some state and federal required testing must be done in person. So what Dr. Barnes will update us on is an example of how, while many things have changed during the past several months, as we have dealt with COVID-19, there are some things that have not changed to reflect the situation. And so while it's our intention to be able to enable our families to choose the full remote option, to make sure that their students stay in remote learning, we must still comply with the state regulations mandated by the North Carolina General Assembly. Dr. Barnes.
Thank you, Mr. Superintendent, Madam Chair, members of the board. Since we instituted the Full Remote Academy, we've been working to figure out how do we well serve all of our students who've chosen that option and their families also. Part of that preparation has been working with our State Board of Education and the North Carolina Department of Public Instruction to talk about our testing regimen for all of our students, and that would certainly include students who are serving remotely. There we go. What we know today is after working with our State Board and the North Carolina Department of Public Instruction, that all of our students will need to participate in our state's testing regimen as part of our state's accountability mechanisms, systems, and processes. Included in that, at this point, we do not yet have a waiver from the United States Department of Education to forego testing. We, as a state of North Carolina and all the 50 states, as well as the District of Columbia and Puerto Rico, received waivers last spring. Our waiver expired, as this indicates, on July 7th. On September 3rd, Secretary Betty DeVos contacted each of the chief state school officers across the country, that would be Superintendent Mark Johnson in our case for the state of North Carolina, indicating that no waiver would be provided to the state of North Carolina or other states. Also indicated that all accountability processes and mechanisms would be expected to be here across the country, including the state of North Carolina. As part of that Every Student Succeeds Act, also known as the Elementary and Secondary Education Act of the Congress, we're expected to test at least 95% of our students. For every student who is not tested below 95%, that student, according to accountability mechanisms, would have to be given a 0 for the school accountability mechanism. And every student below that would count against the school. 95% tested is part of what we'll have to continue to adhere to. And all tests, a part of our accountability system, must be administered in person, as those are secure tests. And at this point, there is no decision or recommendation by the North Carolina Department of Public Instruction to administer those state-required assessments remotely. As part of that, all tests must also be administered online. That does not mean remotely, but that means by a computer as opposed to a paper pencil assessment, which we've done in the past, although there's certain exceptions for students with exceptionalities, which will be made as part of their 504 plans or individual education plans, also known as an IEP. EOCs must count for a minimum of 20% of a student's grade, though there are some latitudes that LEAs, school districts, do have. But the state board policy sets the benchmark at 20%. And there's particular testing windows that we must adhere to. Going from my right to your left, you have a beginning of grade assessment for grade 3. You have a screener for students who are English learners upon entry into a school district, the WAPT and the WIDA screener. And then you, of course, you have our EOCs. And these EOCs, the ACT work keys, and the CTE, career and technical and education, and of course assessments are part of our accountability system. These are the various assessments which would be impacted. I do want to differentiate, though, from our beginning of grade, which some of our practitioners might know as the BOG, or the WIDA. That would be for when students are coming back and they would not have the same type of consequence of not being taken as your end of course assessments, end of grade assessments, or any of the other assessments as part of our accountability mechanism. I understand that there's certain things that the state board has voted on and talked about. I want to hand things over to my colleague, Charles Jeter, to outline exactly what parameters the state board operates under and which ones those of us as a school district we must adhere to as well.
Thank you, Dr. Barnes, Madam Chair, Mr. Superintendent, board members. Charles Jeter, Executive Director of Government Affairs for CMS. Dr. Barnes lays out a compelling case of why we had to give these tests in person. I wanted to give a couple explanations of where we're at and how we got here. CMS has requested in writing formally on June 24th and August 27th of this year for a waiver from this, not only from the state legislature, the North Carolina General Assembly, but also the Department of Education. As Dr. Barnes stated out, no waiver has been granted to us or any other state for this school year. So we don't have a choice. He references these state board policies, which I have a copy here in my hand, and I will post online here momentarily. These state board policies, as you will see, flow directly from federal and state statute. So we are following through what we're required to do. We have asked, we will continue to ask. I don't want anyone at home to think, and I know that it's important for the board and the superintendent to make sure that our folks at home know. We have asked and will continue to ask to get a waiver from this. But as of today, we don't have it. At CMS, we do not have the ability to waive that requirement. And so we're doing what we're required to do by state and federal law. And there's really no option for us. I would remind the board and the public that when the board approved y'all's return to in-person instruction calendar, it had on there at the time a week to week and a half break for in-person instruction testing for high schoolers, where they were going to have to come back for in-person testing prior to returning in January for instruction. So this is something that we're aware of. We will continue between now and then to get a waiver. I can't say at this point we're very optimistic, but we will continue fighting the good fight on behalf of our students and our staff.
All right. Thank you very much. Okay, so moving right along, I'm now going to turn to Dr. Ruby Jones, Chair of the Policy Committee, for the first reading of proposed changes to policy JKD.
Thank you, Madam Chair. Policy JKD, suspension, exclusion, and expulsion of students. Members of the board, the item before us tonight is the first reading of proposed changes to policy JKD, suspension, exclusion, and expulsion of students. The recommended changes focus solely on Section 3, Part D of the policy regarding short-term suspensions. The primary change would allow for an appeal of any short-term suspension that is 3 days or longer in length. An additional change creates a process to track and help eliminate the disproportionality of suspensions. The Policy Committee met on October 14th and considered changes before you tonight. Those recommended changes were approved by the committee by a 4-0 vote. Madam Chair, I conclude the first reading of policy JKD, suspension, exclusion, and expulsion of students. Thank you.
Okay, thank you, Dr. Jones. Now we'll move on to the consent items. Is there a motion that the board approve the consent agenda items?
So moved. Second.
Okay, all those, let's see. Before we move to a vote, does any board member wish to pull any part of this item for individual consideration?
Madam Chair, I'd like to pull item D, recommending approval for the continuation of the school improvement plans for this school year.
Okay, anything else? Okay, so, all those in favor of the motion for all the consent agenda items except for D, please let it be known, please show your approval by a show of hands. Any opposed? All right, that's unanimous. And Mr. Strain, would you like to speak to the pulled agenda item?
Yes, Madam Chair, thank you very much. So the school improvement plans are a core function of our schools, executed by the school improvement teams that are constituted by the North Carolina General Assembly. The school improvement plans function as a key document that a school improvement team consisting of both representatives of the parent community as well as the school faculty, joined by, but not chaired by, the principal, put together for each of our schools, effectively as a policy board for the school. This school year is, at the very least, unique. And I believe our school improvement plans need to reflect the challenges and uniqueness of the school year and for which each of our school communities face. And so in doing so, I don't think it's appropriate to actually carry forward school improvement plans that were made last year without addressing the unique challenges associated with this year.
Okay. Is there anybody else have any responses?
I'll speak.
Ms. Shipp?
Yeah, I'll speak to it too, because as I look at this, I can agree that this is a great opportunity when you think about school improvement plans. These are plans that are made, and you look at them quarterly to see how you're progressing. And I think we don't want to miss that opportunity in a unique time like this to review school improvement plans, look at how you're progressing in your school towards academic achievement, and also with virtual opportunities to get parents to participate in the school leadership team. I think this would be a great opportunity to get that input and support that is hard to get, especially in some of our, Title I schools where they could not come and attend meetings. I think with the virtual piece we have now, and we've talked about how great that's been for parent communication and community support, I think we don't want to overlook that. So that would be also a reason why we want to continue to use that school improvement plan, as we used to call it, the engine for how we operate and how we move schools. So just wanted to add that.
Ms. Marshall?
I think, certainly there's benefit in always looking at this. I think even if we say we're not going to make substantial changes to the plan, that doesn't prevent schools from still doing the things that Ms. Shipp has spoken about, in pulling teams together, reviewing where they are right now. I do think that a big part of the school improvement plan involves data that frankly we don't have. Oops. What? We're good?
Keep talking.
Okay, keep talking. Data that we don't have from our schools at the moment because of all the issues that we are obviously very aware of. I also know that we have asked our school staff to do just an enormous amount of work right now to get ready for things we did not anticipate. And so while I do think it's important to continue to assess progress, I think that the plate is pretty full right now. So I would suggest that people revisit their plans and look at them without going through a yearly process that we do, and then we'll have data, hopefully, that we can then incorporate and do a more thorough update of these next year. So I would encourage us to keep the plans that we have, but also encourage our school leadership teams to continue to meet virtually. I think that Ms. Shipp has made a great point, and I'm thinking we're probably going to have some virtual SIP meetings, and I think that's a great thing. So let's take advantage of this to keep the momentum going, but not add one more thing to our administrative team at a pretty incredible time right now.
Anybody else? Ms. Cheek?
Yes, thank you. Ms. Marshall, I ditto pretty much everything you said. I will say that some of the SLTs have started to figure out a way to try to meet in person. I'm actually going to be meeting with one of my local SLTs in a couple weeks, but they're just meeting, they're just getting back together. And not only is this an incredible burden on the staff, but it's a burden on the parents that serve on those SLTs, who are right now, with the majority of our students in remote learning, they have their hands full. The parents that volunteer for these roles have their hands full as well. And I love the fact that they're all willing to roll up their sleeves and do the work. But that said, without the data from the end of course test and end of grade test from last year, it makes it very hard to make big adjustments in the SIPs right now. So I do support this initiative to put things on pause right now.
Anyone else? Okay, Mr. Winston, did you want to weigh in at all?
Sure. Thank you, Madam Chair, and thank you, board members, for your feedback. I just want to remind everyone that what we're asking for with the continuation of the current school improvement plans is to take advantage of a state provision that allows us to do so. And certainly, it does not prohibit school improvement teams from making adjustments throughout the year to the plans. So it does not prohibit that. But I think as Ms. Marshall and others, Ms. Cheek mentioned, due to the current conditions, due to the lack of data, we're asking for this provision to be implemented as a result of that.
Okay. Thank you. So is there a motion to approve item D from the consent agenda?
I move that we approve item D from the consent agenda.
Second?
All right, motion from Ms. Byers Bailey, second from Ms. Cheek. All those in favor, let it be known by a show of hands. I see 8, and any opposed? I see 1. So that passes, Madam Clerk, by a vote of 8-1. Okay, now we're going to move on to our action items. We have one action item tonight, and I'm going to turn back to Board Vice Chair Thelma Byers Bailey for a motion to appoint Scott McCulley as Chief Compliance Officer.
Thank you, Madam Chair. I take great delight and pleasure in moving to appoint Scott McCulley as Chief Compliance Officer for the Charlotte-Mecklenburg Board of Education in accordance with the terms set forth in the draft contract attached to this motion as Exhibit A. Mr. McCulley's salary will be $170,000 annually. Mr. McCulley will become Chief Compliance Officer on November 6, 2020, and the contract will expire on June 30, 2023. Thank you.
All right, do we have a second?
Second, please.
Okay. We've got a motion from Ms. Byers Bailey, a second from Ms. Cheek. Would you like to speak to your motion?
Thank you, Madam Chair. I almost had to arm wrestle my partner in crime over there for the opportunity to introduce this motion because we have such an affinity and love for Scott McCulley. I have worked with him from the time I think I started on the school board, and I'm sure Rhonda has worked with him even longer. Has been one of the most incredibly sensitive individuals in terms of working with the community, working with the parents, working with the students. It was just a joy to watch it. And it was the outcomes of any time I was involved with anything that he was promoting or he was promoting anything I was involved with, it always works so smoothly. It's such a pleasure to have him back.
Wonderful. Anybody else have any comments before we vote? Ms. Cheek, and then Dr. Jones?
Had we actually arm wrestled, I would have won. I just want to make that point, but I did not make you do that, no. I have had the chance to work with Scott McCulley for 20 years, since the end of the 90s when I became involved and was the legislative chair for the PTA at David Cox Road Elementary School back in 1998. He is a stand-up guy, and many people in this community kind of view him as Mr. CMS because he was so active in this community in so many ways. And so I think that relationship that he already has with so many people in the community, his ability to build relationships with people that he hasn't met yet and has not worked with, will really help us in this compliance position that I served on the compliance committee when we wrote the job description and really kind of decided on how to move forward with this. Scott really does epitomize the work ethic, the love for CMS, and the love for this community that I think will make that position very successful. It'll be mostly an inward-facing role for Scott, a little bit different than the outward roles that he's had in the past, and this will be really working with our staff and with all the layers of our staff to make sure that our processes and systems are in place and are being adhered to. So I'm very looking forward to this new role for him, and I'm just happy to bring another CMS person back to the family. We had another person come back earlier this evening, so just very happy. And Scott, welcome home.
Dr. Jones, I know you've got words to share.
Yes, I do. I think Ms. Byers Bailey and Ms. Cheek said a lot of what I wanted to say. I'm just going to add, I don't think I could have been an effective board member had I not had the opportunity for Scott McCulley to be a guide. I mean, right from the beginning, when I became a board member, he was there to give me guideposts and just make certain that I was effective. And I am just ecstatic, absolutely ecstatic that you're back.
Ms. Shipp?
All right. I want to speak from another end of it. Scott McCauley, I'm just delighted to have you. You know, I've known you for, how many years was I in CMS? Over 30 years. And it was such a pleasure to work with you as an administrator and as a principal, and know that I could count on you to support our needs. When we were talking about lottery, you know, I had magnet schools, 2 or 3 different magnet schools I was involved with, as well as just anything pertaining to supporting our student placement. I could call. You were always so easy and open to talk to. And I will even share, I called about lottery for my own child in the process. And you were so upfront and so, you know, Ms. Shipp, this is the process. This is what you need to do. I know this is difficult. And so I want to thank you for always being, your integrity, your leadership, your character, the way you work with parents and community. It was always so well received. And I want to thank you for that. And I look forward to having you back in this role and being able to work again with you. I think our children even crossed paths at Piedmont, am I correct? Piedmont IV. So it is just wonderful to have you back in this role. Thank you.
Anyone else? Mr. Strain?
Welcome home, Scott.
That's it. So I'll just add my 2 cents here. We had over 70 applications for this position. I want to give a shout out to the ad hoc compliance committee, which was consisted of, looking from my left to my right, Ms. Rhonda Cheek, Dr. Ruby Jones, Mr. Strain, and myself. And this committee built a really great job description with support from our HR department and as well as from Madam General Counsel, Andre Mays. And yeah, that yielded, we did a nationwide search, over 70 applicants. We narrowed that down to 18 finalists and then 18 semifinalists, 4 finalists. And we were, and you know, Mr. McCauley obviously rose to the top, I think because of his deep institutional knowledge of CMS, as many people have referenced, his deep trusted relationships throughout the system. He's got an impeccable sense of integrity, communication skills, great listener. These are all and he knows how to navigate this big sprawling labyrinth of a school system that we have. And so these are all the characters that we need to build out this department and to really foster a culture of compliance within CMS. So we're thrilled that you applied and accepted the job, and you've got a lot of work to do, Mr. McCauley. Excited to get to work. And with that, I will call for the vote. All those in favor of the motion, please let it be known by a show of hands. Any opposed? All right, the motion passes unanimously. Mr. McCauley, would you like to make any comments?
Sure, and thank you very much, Madam Chair, members of the board. I'm thrilled to be back. I look forward to reuniting with you and reconnecting and working with you on the critical issue of compliance. Certainly look forward to working with Superintendent Winston and the leadership team in CMS and reconnecting with our, certainly our numerous staff, principal leaders, and community members here in Mecklenburg County. Next week, my wife and I celebrate 20 years not 20 years of marriage, but 20 years from when we packed up 3 very small boys from Kansas and made our way to North Carolina, and I had the opportunity to lead the student placement department in Charlotte-Mecklenburg schools. And I've had some really good, great experiences here in Charlotte-Mecklenburg, as well as in Guilford County, and look forward to coming back and working just as hard. Certainly, we're members of this community. We believe in the school system. We believe in public education. Our 3 sons are graduates from Charlotte-Mecklenburg schools, and I very much look forward to getting to work, certainly to improve, ultimately, student outcomes. So thank you very much. Look forward to getting started to work.
Wonderful. Thank you. All right. So we're now going to move on to the reports for the evening. The first is going to be a report on our readiness metrics, and I will, before I turn to the superintendent, I'm just going to ask board members to hold your questions until the end of the report. And then once we do go to questions, I'm going to give everyone, we'll each take turn asking questions, and we can each ask a maximum of 3 questions. So I'm just going to ask you to hold, if you have a follow-up or commentary after a question, just hold on to that, for that to be your second question. I'm going to just enforce that across the board. So I'll use the hammer, the gavel if I have to. But with that, I will turn this over to you, Superintendent Winston.
Thank you, Madam Chair. I am extremely pleased to report that we are moving forward with our plan to return our K-5 students for in-person instruction beginning on Monday. We've been planning for this since March, and as we've discussed at several board meetings, we have been collaborating with our learning from our partners with the Mecklenburg County Health Department, the County Health Department's sharing of information and advice with us has been extremely valuable as we consider how to safely and effectively open our schools for in-person learning. Our county health partners have informed the development of our metrics. Because we are in contact with them regularly, we benefit from their insights as we focus on making the best plans for providing educational opportunities for all CMS students. Before I introduce our next guest, I want to mention regarding the readiness metrics that this past Monday, we began a public walkthrough of the data that we post each week. We believe that this will help provide the context needed beyond the numbers and help our families, our staff, and others in our community better understand what the data means for our return for in-person instruction. Our current status is that we are ready to bring back K-5 students to our buildings next week. We're moving forward with our return. As the dashboard states, we will consider the in-person school openings based on a holistic view of several factors. If a change in metrics necessitates a different decision, we will bring that to this board for a future, at a future date for a vote. Now, I would like to introduce and recognize our Chief School Performance Officer, Ms. Kathy Elling, and Ms. Elling will present the latest metrics dashboard and provide context for what this data means for CMS as we move forward with our phased return for in-person learning. Also with Ms. Elling is Ms. Gibby Harris, our Mecklenburg County Public Health Director. And we thank Ms. Harris for joining us to answer questions about broader COVID trends in Mecklenburg County. And we thank Ms. Harris also and her team for your insights and guidance throughout this pandemic. Thank you so much, Ms. Harris. Ms. Elling, I will turn it over to you.
Thank you, sir, and good evening, board members, and good evening, community. I want to share with you 2 types of dashboards that we're keeping. I think it's important to know the distinction. The first one you are looking at is our weekly at a glance It captures a week at a time, and this week ended, as you'll notice, at the end of last Friday. We are tracking, as you can tell, the number of students that are in person at the time. So for the last week, we've had our preschool students in schools, and we've had populations of exceptional children in schools, and that number is roughly 2731. 8 students were positive in that week time. We are charting also against our over 19,000 employees, and we currently have 16 positives. That number will change every week. The total population of our employees is going to remain constant. We made a decision to do that purposefully because we believe all our employees, whether they're working in a warehouse, in a school, in any of our facilities, or teaching remotely, their ability to serve in that capacity is contingent upon their health, and we want to make sure that if we track both their positives and incidences of quarantine. Down below, I'm going to open up our readiness dashboard. This is a 14-day rolling count that syncs with the Mecklenburg County data. And so we actually draw our public health metrics from Mecklenburg County. Gibby will talk a little bit more about that. We are, as you know, in the red right now. We have 120.7 cases, and that's over the 100 in 100,000, and that puts us in the red. You'll notice the positivity rate puts us squarely in yellow, at the lower end of yellow. And we're tracking both the number of cases and the rate of spread. And it's important that we look at those two things holistically. And I know that Gibby's going to talk about that, and I want to defer to her expertise. We are also tracking cases in schools, the number of schools with at least one positive, and we are yellow. We have no quarantines. We have no schools that have 25 persons or more in quarantine. School level case monitoring. At this time, we're in yellow, which means we have more than one individual at a particular school that is positive, but that number squarely sits within the 2 to 10. We have no clusters, and that is important to know because we have had students in classrooms across our county and I'm trying to think, right at 65, 70 schools perhaps have had students already, and we have 0 clusters showing up in those classroom environments. Right now, we are tracking, of course, individuals in quarantine because quarantines also impact our ability to serve students, and we are in yellow at this time. We would anticipate, if we do our job right, and Gibby, you can correct me if I'm wrong, if we do our job right and we capture the quarantines, we may see more quarantines, but that will prevent actually the spread of the illness because we're being extra careful in close contact tracing. District operational measures, I'm happy to report that at this time, and I want to clarify, we are tracking operational metrics against the next phase. Like, are we ready to open in-person elementary? This doesn't benchmark against opening middle school and high school at the same time. This is where are we with Monday's green go for elementary. And we are good, as you can tell, in child nutrition, transportation, custodial, and our nurses are sitting in yellow, and we're meeting again tomorrow to ensure that we have a coverage plan for all of our schools that are opening on Monday. School readiness metrics, we are green, which means we're go with staffing. Our teachers are adequately staffed. I'm happy to report school facilities have moved to green as a result of Friday. That means our classrooms are set up. We needed to ensure that every one of our K-5 classrooms were set up in ways that we had outlined per DHHS guidance and to the extent possible with max social distancing, and we have accomplished that. So that is also green. Our PPE and infection control is in green, where we have supplies delivered to schools. We have a process by which they can reorder supplies. And our health and safety training is green, and we've done, we're at a high level of training around what is COVID, how do you handle it, what do you do if you have a suspected case. So we are poised we are poised to go per, you heard the superintendent reference that. So that is where we are at this time. And before I take questions, I thought it might be helpful if Gibby could come up and share some additional information.
Thank you, Kathy. Good evening. I appreciate the opportunity to talk to this board this evening. Mr. Superintendent, this has been quite a journey to get to this point, and I want to reinforce what you said about the partnership between the school system and the health department. We are working with your staff almost daily on all sorts of issues around COVID and around school nurses and around doing everything we can to help you be ready for students coming back next Tuesday. We are definitely in support of that happening. Just to speak briefly about the metrics, I want to remind everybody that we have said from the beginning that no one metric can determine what you need to do. It is not driving anything in our community. It's look at the different metrics together and how they translate into what's going on in our community. Kathy did mention that we are in the red in terms of our case count, but our positivity rate continues to be in the low yellows. We're around 6.4 right now. We'll have a new report that comes out on Friday. One of the reasons for the case count being up is we are testing more right now. We've got more availability of testing and more people being interested in being tested. So you're liable to find more numbers because we do have community spread. But the thing we are continuing to watch is that number is going up and our hospitalizations are slowly going up. So we know that we are needing to very carefully watch what's happening in the community and be able to be responsive as those things change. But as we sit right now, we believe that the school system is ready to open up on Tuesday for the elementary students. The school efforts that have been put in place are ones that we are very comfortable with. The arrangements in the schools, the work that's been done with the staff, the training that's been done with the staff, and the things that have been put in place that are going to allow for students to come back in safely and for teachers to be safe in the schools. We feel like the school system has done an excellent job to prepare for that. I know there's a lot of question about school nurses. At this point, we will have 151 schools open or something around that on Tuesday. Right now, we have 126 school nurse positions, so we are a little short. But we do have plans and we are managing that based on the needs of the specific schools to make sure that all schools are covered with the needs that they have. I want to reemphasize what we've talked about before. It does not take a school nurse to screen staff and children as they come into school. It does not take a school nurse to take a child from a classroom to the isolation area to wait to be picked up. It takes a school nurse to be available to consult if there's a particular question or particular concern. And our school nurses, as usual, are more focused at this point on the specific health needs of students in the school system. That's what our school nurses are there for. And there's more to their school health than just COVID at this point. So we want to reemphasize the fact that we feel like the schools are going to be well covered on Tuesday, and we will continue to monitor that. We're continuing to hire nurses. Our HR department is working with us, and we are looking at ways to continue to encourage nurses to come into school nursing. So I am comfortable with where we are with that at this moment. I think that one of the reasons that we're very comfortable with where you are and what you're moving into next week is because we're focused on elementary. The research that's been done up to this point shows that children under the age of 10 are less likely to be infected and less likely to spread COVID. That doesn't mean that they can't get it. That doesn't mean they can't spread it, but they're less likely. Most of the metrics that we look at show 18 and under. But if you break that down, the majority of those fall in the 10 to 18 age range. So the fact that you're focusing on this age group is comforting, I think. The other point that I will make is that our child care centers have been open from the beginning of this pandemic. We've had some preschools open for quite some time now, and some of our private schools have been open for some time, and we've been working with them. And we are not seeing significant outbreaks in classrooms, especially in those age groups. We have had some cases. Most of them have come from the outside. These children have been infected outside of the school system and come in, and they have a case, and we're able to isolate. And in some cases, we do quarantine because of a lack of social distancing or masking. But in most cases, we are not seeing spread in the classroom, and that is good news. We do want to emphasize the prioritization of classroom learning for the children that are coming back to school versus some of the extracurricular activities. Unfortunately, that's where we are seeing spread, is things that happen outside of the classroom, whether that's sports or birthday parties or whatever it happens to be. So I guess one of the main points that I want to make is parents, teachers, staff need to think about their behavior, not just in the school, in the classroom. They need to think about their behavior outside as well, because it's the exposures that they're having outside of the classroom, outside of the school, that may put them more at risk and allow them to bring it into the school. So it's not it's not a 8 to 5, right? It's the gatherings that you go to outside. It's not wearing your masks and social distancing outside of the classroom, where we're seeing most of the exposures. So we want to encourage parents, before they bring their kids back, if they haven't already started talking to their kids about wearing masks and how to wear a mask appropriately, that they're doing that before the kids come back in. We want parents modeling this behavior for their children outside of the classroom, the social distancing and the masking, and being careful where they go. And we also want to emphasize that they should not bring their children to school if they are ill. We have a culture where the work ethic is to work unless you can't. This is not the year for that. We don't need teachers, we don't need staff coming in if they are ill. We need them to stay home. And the same goes for our children. We don't need parents bringing our children in if they are ill. They need to stay home. And if they're ill, they shouldn't be bringing the siblings in either, until there's some reason to believe that it's not COVID and it's not infectious. So I want to reemphasize that. And the last thing that I will say before answering any questions is just to encourage everybody, children, parents, teachers, staff, everyone to get a flu shot this year. So thank you. Happy to answer any questions.
All right. Thank you, Ms. Harris, for being here tonight, for your constant availability to partner your staff with our staff, and just for your diligence. And I just want to clarify that the first day of school, we're talking about K through 5 coming back to the classroom on Monday, not Tuesday.
No, thank you.
Yeah, Tuesday's
sorry.
another big day.
The days have a tendency to run together for me these days,
Yeah,
so
I'll
thank you
bet.
for
I
that
can
clarification.
imagine. So with that, I'm going to start the questions, and I'll turn to Mr. Schul first and then work my way around.
Hi, thank you for the presentation. My question is the same as the last presentation, which is, I know Ms. Harris spoke about general trends about tracing, but I was wondering if there was any specificity about whether we could trace those positive cases to within the school or not within those schools that we have, new cases.
Make sure I understand, the cases that we currently have experienced and tracked have all been cases that have originated outside of the school building.
Okay, perfect, thank you. And then I was just wondering.
Sorry, just one question, and then we're
Oh,
going to.
I'm sorry. My
Yeah,
bad.
and then we'll come back around.
Yeah.
Mr. Strain?
First of all, Ms. Harris, thanks for being here with us. The partnership is obviously absolutely critical to our success in terms of our mission, and our success as a community in terms of battling this pandemic. My question is whether you've had a chance to look across the state as we look beyond the direct horizon, which is next Monday. That's the horizon on which we focus, frankly, and we owe it to ourselves, our students, our families, our community to actually look beyond that. And I'm wondering if you've had a chance to look at the middle schools and high schools that have returned across the state to see if the same characteristics are holding that you described with respect to low transmission rates, if at all, within the schools.
What I will tell you is what we are seeing so far is there is some increased likelihood of cases especially in high school, but in some cases in middle school. And I think there's a number of reasons for that. Obviously, our high schoolers are more active. Many of them have been involved in sports and other things that have allowed virus to spread. And that has been a bit more of a challenge, I think, in some cases. Middle school is sort of it is definitely one of those things that we need to watch closely. And we are looking at some other school systems to see what's happening across the board. The good news is that we are not seeing a lot of spread in the classroom. And that is the good news. We're not even seeing much spread in the classroom in colleges. It's the activity outside the classroom. And that's the challenge, because you can't control that like you can control what's happening in the classroom. So the thing that we have to be able to control is making sure that we're screening kids and that we're catching them when they come in, when they might be infectious, and that we're getting them out of the classroom as quickly as possible. And I will say that with the few cases that have been mentioned today, we've had practice with our processes, and they've worked well between the school system and the health department in capturing these things quickly and addressing them appropriately. So I think that's how we're going to be able to manage that, because we can't control what people do outside the classroom.
Thank you.
Ms. Shipp?
Yes, I know you talked about school nurses, but I think this area is so critical, because I think the schools and the teachers and staff really trust, and I've been there with the nurses, and we really trust those nurses and the role that they play. And I know in many cases we have not had the nurses to do some of the things that we really are looking at support from them for now, because they're the experts in understanding what to do with COVID and what is happening, the contact tracing, and getting the help they need. And I think it's going to be really hard to say if a school does not have a nurse, or they're dependent on a nurse 2 or 3 days a week, to find that staff, which is what you're saying, that will monitor those isolation rooms and will do this and do it effectively. There is some fear there and timidness there, even with the training. Who will do this if not our school nurses? Or we've talked about bringing in other support, right, Ms. Ellen, that will do that. And I think we need to know that they will be doing that, instead of this sense of who are we going to do, the teacher assistant, the art teacher, the PE teacher. They're concerned that they will be doing all of this and making all these large number of contacts with students, because they're doing a variety of things, and then ask the teach as well.
So I would say that we have experienced high requests and people volunteering to do the training to serve in the as a contact for the isolation room. I can understand some of the anxiety. It was like the first time we walked a principal through a positive case. It's like just getting comfortable with understanding the process and feeling like yes, this is going to work and we're going to help you and this is a step you take. I think the same is true we've had kids in isolation rooms. We've had an adult or two in an isolation room, and I'm reiterating what Gibby shared, is that the isolation room is a point where the person or student can be saved until we can get them immediately picked up and taken care of. And so far, that's working. You may know that we have also, in cases where families are really strapped and could not come and get a student, we've made arrangements, our transportation department has made arrangements to have buses available by geographic area, and they are helping us with that service. So kids are getting picked up, or parents are, if we absolutely can't get a hold of somebody, we're handling that. So I'm not going to downplay the anxiety, but I do think the process is in place and we just need to work the plan.
And that's good to hear, because that's exactly what they need to hear.
We're not doing follow-up, sorry.
We're not doing-
Just save that for the second round, if you don't mind.
Well, I just wanted to add one thing, too. There will always be a school nurse available. They may not be on site at the moment, but in addition to that, our communicable disease nurses are always available for consult. So we are making sure that the schools have ready access to somebody that can help with decision-making or questions to make people, to help them be more comfortable in those situations.
Ms. Marshall?
My question really goes back along with the school nurse issues. We've seen that we know, we indicate we have, of the 150 schools that we think are going to be open, or that we know are going to be open on Monday, we have vacancies in approximately 25 of them. I know we have certainly nurses assigned to schools that won't be open, or may not be open as much yet. I know we've got certainly high schools, although they have exceptional children classes in those high schools in many cases. Are we looking at shifting some staff right now? Okay, I've asked my one question. Are we looking at shifting staff right now? Somebody else might pick up the second part. We'll see where this goes.
Yeah, there actually is a plan in place looking at the specific needs of the specific schools. So some schools will have a full-time nurse because of the specific needs in that school, the health needs of the students in that school. Some will have a nurse 4.5 days a week. Some will have 3.5 days a week. Some will have 3 days a week. So we have worked our nurses. Some will cover more than one school, and that will allow us to make sure that there's at least some level of coverage across, and that there is a nurse that is familiar with that school and what the needs are in that specific school, and be available to that school even if they are not on site that specific day. So it's not like any of the schools aren't going to be covered. It's just that we have in some situations, we've had to modify a little bit to make sure that we've got the coverage that we need in all the schools. So all of the buildings will have some level of coverage.
Thank you.
Ms. Byers-Bailey?
Thank you. I'm focusing not so much on the schools in terms of the emails that I've been getting. When that first dashboard element turned red, my emails blew up. And the assumption by the public is that that's what's happening in our schools. And it's my understanding that that's what happened in the community, not in our schools. What can you say to the parents who are whose minds blew up when that thing turned red, to reassure them that it's not in the school, it's in the community. It's a cause primarily from one incident in one location that turned into a hot spot, and the red is the result of that, but that is not representative of what their children are going to walk into on Monday morning.
That's a great question, and I know anytime anything goes red, it causes anxiety. That number indicates the amount of virus we have in our community, not in our schools. And as I mentioned earlier, the few cases that we have had in the schools have come from that community spread. not from the school setting itself. So that's why I was emphasizing the need for people to do those things that we know prevent spread in the community when they're outside the school setting, because it reduces the risk. We need that across the board so we can get that out of red for our entire community. But that is just an indication of what is happening in our community right now. We are seeing additional cases, and that's basically what that means. But that is not indicative of what's going on in the school setting.
Ms. Sawyer?
Thank you. How do we assure that transmission isn't happening in a school setting if we don't test students? Because I know they're asymptomatic spreaders. How do we know that when a child tests positive or an adult tests positive, that they weren't infected by an asymptomatic spreader, since we don't regularly test? I mean, I think this came up in the Stanley County case. So how do we assure people that we know what's going on when we're not testing?
That's a good question as well. Unfortunately, we don't have the ability right now to do rapid testing that does a good job of picking up asymptomatic cases. That testing opportunity is not readily available to us in this state. We're hoping that will happen soon. That would maybe allow for some of that to happen in the school setting. Right now, what we depend on is people wearing their masks and socially distancing. Most of the data shows that when folks are asymptomatic, the spread is not as infectious as if they're symptomatic. So if they're wearing their masks and they're socially distancing, the likelihood that they're spreading as rapidly is lower. And so we need to make sure that people are continuing, and our children are continuing to wear their masks and socially distancing in the school setting. And then if we do have a case in a classroom, then we really need to consider what the amount of exposure was and whether we need to quarantine that group until they can be tested or until their quarantine is up.
Ms. De La Hara?
Thank you, and thank you, Ms. Harris, for being here and for your continued partnership. I'm very, very grateful. My question was along the same lines as Ms. Sawyer's, which was going to be, if you could speak more to the testing, like what is our current turnaround time? And you mentioned the rapid testing, and maybe you can help clarify this, because I had read something recently that was not very accurate. Maybe it's getting better, but what kind of testing would you like to see? You almost insinuated that we may get better testing in the future. Could you expand more on that?
I can. So there is a rapid test that's available right now. It's an antigen test. It is not terribly sensitive, and it's only recommended for people who are symptomatic. If you believe you've been exposed and you have an antigen test and it's negative, we are still recommending, and the recommendations from the CDC and the state are that you also get followed up with a PCR test to make sure that you're actually negative, because we get a lot of false negatives with the antigen test. So that test is fairly readily available, but unfortunately, it does not always tell the full picture. So you may get that as a quick test, but then you may have to follow up with a PCR test. The good news is the PCR tests in many cases are coming back in less than 24 hours. Most are coming back within 48 hours. So there is a fairly quick turnaround, and those are readily available in our community right now. We've actually been we've had the ability to do some surge testing, and over the past 2 weeks, we've been offering testing to all teachers and staff through the school system. It's been interesting considering the concerns that people have voiced and stuff. We haven't had a huge uptake in those tests. I think over the 2-week period, we'll test about 1,400 people out of the workforce. And to date, we've only found a couple of positives. So that's good news. The test that I was talking about, there is a rapid test that's similar to the PCR that's more sensitive, but they are not readily available at this point. There are a few places that you can get it in the county. It's a quick test. But once those are readily available, it will be easier for us to do any testing that we need to do in situations like a classroom or something like that. In the meantime, we've worked with some of our testing partners to make sure that they have the rapid antigen tests available, as well as can do the PCR tests. And we'll be working with the school system if there is a need to test a classroom, to test a child, to test a teacher. So we have worked out some of the kinks around that to make sure that that testing is readily available right now.
Dr. Jones?
Okay, mine is more of a practical type question. Given the shortage of nurses and students, more students coming back into school, do we have any process for utilization of social workers collaborating with the healthcare workers for home contacts and that kind of thing?
We have used additional funds to contract with nurse agencies for nurse extender positions. And we have assigned those to schools based on some of the factors that Ms. Harris referenced in terms of what do we know about the overall health conditions of the school in general. And we're anticipating, so we directed staff, the nurses that we had, the extenders. Our school-based staff, I'm not sure this is what you're asking, but our school-based staff, our social workers, are really going to perform all of the social work duties that we know we need to be performed as we work through bringing students back and assessing them and talking with them and making sure that they have the basic needs that they need covered. So typically, I'm thinking as a building principal, we have typically staff perform a range of duties and they're very willing to help out with screening and things like that. So I anticipate that it'll be an all hands on deck. With that said, we want folks appropriately trained to manage the isolation room. And I guess I want to hit that the PPE that is most useful for everyone at this point is the face coverings. Right, if we keep our face coverings on and we stay 6 feet apart, that's going to go a long way to supporting the reentry.
Ms. Cheek?
3 questions. I know, one question at a time is killing me. I'm a nurse. I spend every day, I told somebody today that I have not had a week off. I have had some days off since March 16th, but I haven't had a full week off. I understand where you are and admire you, and our nurse blood runs well between us, I'm sure. Mine is more of a kind of a commentary question. When you mentioned that the spread is mostly in outside venues, I feel safest when I'm at work because I work in doctor's offices where we're in masks, we're socially distanced, we're following the rules. I feel that our schools are going to be a similar place. And I feel that our staff, while they're in very heightened anxiety, and I personally had heightened anxiety back in March when I was so anxious about this. But when I feel like when they get into their building and see the practice in place, the protocols functioning with the students, they'll actually feel safer there than just about anywhere else, maybe other than their home. And I do understand that a lot of people would prefer to stay in their home based on all the emails we've seen. But what I will say, I don't think we've had a lot of spread from doctors' offices. Have we had, doctor's offices, clinics, urgent cares, all those places, even where people are coming in to be tested, have you seen significant community spread or spread through those clusters through there?
No, we have not. We have had some clusters in work environments, but none that have had the processes and the supports in place that the school system now has in place to be ready for students to come back. So I agree with you. I think the school environment is going to be a safe place for students and for faculty, the staff and the teachers. My concern is what's happening in our community right now in certain places. And so, again, encouraging parents and teachers and staff to stay away from those places where they could be exposed. That is going to help us tremendously in making sure that the schools can be successful and stay open for our children.
So you're saying if it's a place that's really monitoring and following the protocols, that there is a very high safety factor right now?
Absolutely.
Okay, I'll stop. I wasn't supposed to let you do that.
That was just
Okay, Mr. Shul, second round of questions?
My question builds off Ms. Marshall's, which was when you mentioned that the specific needs of a school are used to determine nurse coverage. Could you elaborate on what criteria are used to determine that?
Yes, we look at the healthcare acuity needs of the students in that school, the number of students that need specific assistance, the healthcare plans that we're monitoring and working with physicians on with the students in that school, in addition to the number of students that are in that school. Obviously, the schools that have more children who are under some type of health care during the day, making sure that staff are trained and that they have the capacity to meet the needs of the students. So all of those things go into determining where we put our emphasis, but again, making sure that there's coverage across the board.
Mr. Strain?
Thank you, Madam Chair. Ms. Harris, I want to kind of move out of the classroom for a second in the school building, because the other place we have students and staff together is in the school bus. And, you know, as it stands, there's literally tens of thousands of miles traveled every day in this state with school buses. Today.
Yes.
And for the last several months. So have we seen any indication that that can serve or is serving as a nexus for the transmission of the disease?
We have not seen anything specific at this point that points to school buses being a particular problem. I do have some concern about school buses just because it's hard. If you're going to transport as many kids as you're going to transport, it's going to be hard to do the social distancing that we'd like to see on the buses. So it's going to be important for kids to make sure that they're staying as far apart as they can from each other and that they're wearing their masks on the buses. But up to this point, we have not seen that as a significant mode of transmission.
Thank you.
Ms. Shipp?
My question is about school readiness, and you said that, Ms. Ellen, that the classrooms were ready. I'm concerned about social distancing because we keep saying the 3 Ws, and especially with wearing masks and this distancing. When we looked at our plans for splitting now A day and B day, and we're going to have more students in the room, are we feeling comfortable? And talk to me a little bit about the distancing of 6 feet. I think we saw classrooms that we were looking at, and it may even been on the news, and it didn't appear that we had the spacing. So how are we working through that? And I think I've also heard comments from staff. How are we working through this distancing of 6 feet in classrooms that are smaller?
So
and
we're,
more students?
to the grade, we are setting up classrooms to the maximum social distancing possible in all of our classrooms. With the governor putting us in Plan A, and we chose to bring 50 and 50, we are not saying that in every single instance we can guarantee that there's going to be 6 feet apart in every single classroom. We are saying that we are going to maximize the distance between all of the students, and we're going to reinforce the other protocols around that. Keep your face covering on, wash your hands. When we line you up, we can accommodate the 6 feet. We're going to do all of the protocols that we have outlined.
Thank you.
Ms. Marshall?
Before I ask this question, Gibby, I did not thank you again for, just as my colleagues have, for your continued partnership and the partnership with your colleagues. It's very meaningful, and it's the way we should be working together, and I want to thank you and your colleagues for that. In my estimation, the very first few moments of the day as students enter the building may be the most important time for teachers and for staff and for student safety and wellness. So one more sort of piece with my nurse line of questioning. My estimation is we're going to see more folks enter that isolation room at the very first of the morning, at the very first thing. Will we have those nurse extenders to help with those folks that are in places where we don't have a full-time nurse at that point? How are we going to manage those first few minutes of the day in terms of that isolation room and that health and safety component?
I do think there's going to be more attention. In any of the plans that we've worked on with any entity in the county, sometimes the biggest issues are ingress and egress. How do you handle people coming in, and how do you handle people going out? And so, yes, there will be special attention paid to those times of the day to make sure that we have the resources available to address issues as they come up, as students and teachers and faculty are coming back into the school.
Thank you.
I skipped myself with the last round of questioning, so I'm going to ask a question for Ms. Harris in terms of community spread, and you spoke to this briefly earlier, but I just want, while we have an opportunity to talk to 19,000 employees and 100 and some thousand families, where is it that people in Mecklenburg County are catching COVID? Where are you finding clusters arising? Because I want us to be able to say that so that when the CMS family is outside of the school, we can be extra aware and vigilant. Because that's what I'm hearing is the spread is happening outside of the school. In nationwide, we're not seeing that much spread within schools. But we need to manage the spread everywhere. So where is it that our CMS family needs to be extra vigilant?
The issues that we're seeing in our community right now that are contributing the most, any kind of exposure can contribute. But the issues where we are seeing the most contribution of cases is just about any size gathering. That's people outside of your usual sphere of contacts. And in many cases, that's outside of your family. And when I say family, I mean the ones that you live with. Family gatherings are a cause for concern when you're bringing people together that don't normally live together. Any size gathering, we're concerned. This is Halloween weekend coming up, and the potential for exposure is a concern. I think there are safe ways to celebrate Halloween, and we've put guidance out there about how to do that. But some of these large gatherings, some of these ways of people coming together and not social distancing and not masking and spending a lot of time together, those are the places where we're seeing the most spread in our community. So those are the type things you need to avoid. And those are probably the hardest things for us to avoid. We are social people. We want to be around other people. I know my granddaughter is just dying to get back to school. She wants that, she craves that interaction. And anytime she sees another child, she wants to go play. But at the same time, she's also gotten the message loud and clear, so when anybody gets too close to her, she's backing up, which is a good thing. But, I think that is the challenge that we have, is that people are out and about in our community. We have opened more things up, which is good. I'm not saying that people shouldn't be out and about within reason, but it's the gatherings that are causing the problem.
Okay. Ms. Byers-Bailey?
Thank you. I'd like to say first that although we get a ton of emails every day regarding all of this. And I don't often, they don't hear a response from me. It's not because I didn't read it. It's because I didn't have an answer, so I'm going to ask one of the questions that I have gotten repeatedly tonight. I got more than one email from teachers, K-5 teachers who teach special classes, the music and arts and those things, where they don't have a set room with a set number of kids and they just only interact with those. They're on a cart and they go from class to class to class. So in effect, they are in a room with all of the students at one point. And then they're asked to serve also as the person in the bus parking lot when the students are getting off the bus and when they get on the bus. So they have, in a one day, they have interacted or been in proximity with every student in the school, whereas their teachers who were in the classroom were only exposed to the students that were in their class. So they feel like they're getting a triple, quadruple dose of whatever was there, and not necessarily even being socially separated from them because they're going past them. So they feel like they're more exposed than their counterparts, and that therefore they're more at risk than their counterparts. What is your response? How do you make them, what can you say to them to make them feel less at risk?
I would depend on Kathy to speak about the procedures that the school has put in place for those particular types of teachers. What I would encourage is, number one, is that the teachers understand the layouts in the classrooms and that they're doing the social distancing and the masking that needs to be done with the students, regardless of which classroom they're in. It's probably as important, if not more important, for them to maintain cleanliness as they're moving their cart around, that they're washing their hands very frequently throughout the day, that they're using hand sanitizer regularly. I'm not as concerned about the kids walking past them onto the bus, because that's such a limited period of time that a potential exposure is not a terrible concern at that point, even though there's a volume going by. It's just, there's usually, basically, CDC has changed their guidance around contacts and are basically saying, instead of a solid 15 minutes around someone, they're talking about 15 minutes over a 24-hour period of time, but they're not engaged with that one student for 15 minutes over 24 hours. So I think there's, I know it's challenging because they are being exposed to more people in a day than a regular teacher would be, but I think if they maintain the prevention messages that we're talking about and the things that the schools have put in place to allow them to maintain cleanliness and washing hands and wearing masks and socially distancing, they'll be as safe as they possibly can be.
Thank you.
Ms. Sawyer, your second question?
Sure. I've heard of schools asking their PTAs to purchase N95 masks or air filters, air purifiers for their classrooms. Are those wise investments, waste of funds, useful?
I'm not sure I'm an authority to comment on whether those particular items are of value or not of value. I will tell you that we've talked with learning community superintendents about, and with our chief financial officer and our chief operating officer, around, are there other PPE items that we may need? Some schools have raised the request for additional plexiglass, for example. So what we've asked our learning community superintendents to do is to work with principals over the next 2 weeks while we get students in classrooms and assess what's actually going on when we get people in buildings and make some determinations about what we need. And then we're coming together as a group to raise up items that seem to be universally needed. And that's when we believe our funding from the district should purchase those items for classrooms.
Can Dr. Harris answer that as well? And just in terms of the is it worth it for?
The efficacy, I'm not an expert on some of that machinery and how it works, how well it works. A lot depends on, I do think there are some of those types of pieces of equipment that can be useful in some settings. Whether they're helpful in a classroom or not, I can't speak to that. I know that the work that, and again, I'm not an expert when it comes to the whole, well, the N95s are not necessary in the classroom setting, unless the only time we're concerned about N95s in the classroom setting if there's an aerosolized procedure, if there's a child that's having to be suctioned. And we've worked with the school system to adjust locations for that to happen so that it's safe. But in terms of N95s, we are still not in a position where those are readily available, and they should be saved for our healthcare providers and our first responders who need those on a daily basis.
Thank you.
Ms. De La Hara?
Thank you. So over the past couple of months, I've received several emails from teachers and possibly other staff who've, just shared some heartbreaking stories of their particular conditions that are putting them, in a high-risk category, or maybe it's their family members, et cetera. And I know that they're having to make really tough choices. And you may or may not be aware of this. And the last time I checked with HR, this was still the case, that the CDC had put pregnant women on their at-risk list. However, the federal legislation that was passed doesn't allow for a leave based on that. And I'm stating that not because I expect you to fix it or any of us really here to fix it, but more as a statement, because I do know that unfortunately many of our staff do feel unheard, not listened to, and there's just it's very complicated. And we certainly here at this board don't have the authority to make all those decisions or to provide leave for certain situations that aren't approved under those guidances. But I guess I just wanted to kind of preface my question to you to just say to the teachers and other staff who may be listening that we do hear you. We understand, and I know that there are tough choices that are currently having to be made. So with that said, with specific regard to teachers who may be pregnant, has there been any more, now that more time has passed and babies possibly have been born, is there any more information that we have medically that you are aware of that could be encouraging?
Not specifically at this point. I think it's one of those evolving situations that we've seen with COVID since the beginning, is really trying to understand the impact and the potential risks. And believe me, I understand the situations that some of your teachers have found themselves in with their families, with their own health. That has contributed to the fact that we don't have a nurse in every school, because we have some nurses who are in that situation as well, who are not able to work right now because of their own health condition or the situation at home. So that is an ongoing challenge for all of us. And we are doing everything we can to be as supportive of our staff, to understand their situations, and I know the school system's doing the same as well. As we learn more about the impact on pregnancy, we'll make sure that information gets out. But again, it's one of those evolving situations that we're watching closely.
As we continue through our questions, I think it'll be good to clarify, board members, when you have a question, whether it's directed to Ms. Harris or Ms. Elling or both. So Dr. Jones, do you have a second question?
Yes, as a part of my first question, Ms. Ellen, what's a nurse extender?
Thank you, ma'am. A nurse extender is a LPN typically, and they are out in our community providing all kinds of services, and we've contracted with them to come in and extend the services that the school nurse would provide. So we are directing them to help us with managing helping us with the isolation room, with the health room. They may advise us on screening students as they come in. They're going to extend any kind of service that's health-related for our schools to literally extend what school nurses would provide, were we able to put one in every building.
How many do we have?
And I will say that, and that is something, some of our schools are so large that even one school nurse is not enough. So we have used LPNs in that way in some of our larger schools before, so it's not new. And having them there and able to access a school nurse to ask a question can help facilitate work in that setting when the school nurse isn't present.
Ms. Cheek?
Gosh, there's so many different directions I could go. I guess we'll just stick to school nurses because that's near and dear to my heart. My mother was a school nurse in CMS. She had 3 schools at that time. 3, high school, North Meck, J.M. Alexander, and Blythe Elementary were all 3 her schools back in the day. So, and right now, to become a Mecklenburg County Health Department school nurse, you have to have a BSN, Bachelor's in Science and Nursing. I've been a nurse for 37 years. I have an associate's degree in nursing from Central Piedmont. I have a bachelor's degree in something completely different and 38 years of experience, certified trauma, et cetera, certified emergency nurse practitioner, blah, 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 you name it. I have several certifications. I could not apply and get a job as a school nurse right now.
Might make an exception.
Would you like a job? So I actually have been a volunteer before in several health rooms throughout my career of like 8 schools that my kids have all been to, because I had kids in school for 23 years in CMS until this past June. My question would be, in today's environment, there's a lot of nurses that have been cut from their jobs at hospitals and clinics because the work is not there right now, because a lot of elective work is not happening. Would you consider, from the health department standpoint, looking at nurses like myself that don't have the bachelor's degree, but have the work experience, potentially a degree in biology? There's a lot of nurses that go to science majors and then and they don't find a job and they come back and do a 2-year nursing degree to go along with it. So, and I know that my colleague on the county commission has already asked you this on my behalf. So I would just ask you, in light of where we are now and for the future, would you consider changing your job requirements so that nurses like myself who are eminently qualified to do this work would be hireable by the health department to fill these roles?
We are in conversation around that right now. We are moving towards trying to make sure that we're going through a process. There is national certification for school nurses. Mm-hmm. And it really does require a BSN. And that's one of the challenges that we have. If we're trying to get all of our school nurses certified, which we would like to have, it creates a challenge not to hire a BSN. However, we are looking at the ability of hiring RNs if they are interested in pursuing a BSN that we could help them with and get to that point. So we're looking at options right now. We're across the board because, as you know, we've had a nursing shortage off and on for years. I don't think it's ever going to completely go away. There's never going to be enough. So yes, we are exploring that option right now.
Thank you. On behalf of all the other associate degree nurses graduating from Central Piedmont Community College.
All right, Mr. Schul, do you have a third question?
I do not.
Mr. Strain, do you have a third question?
I do have one. Ms. Harris, 3 weeks ago, the governor authorized schools to begin Plan A for the elementary schools. There are a number of counties and LEAs who have taken that opportunity to return to full-time in-person instruction for those families who chose to do so. Do you have any information yet from your colleagues across the state in terms of whether that decision to go with full Plan A has indeed increased the amount of transmission that's taking place in the elementary schools, or whether the precautions that they're taking are sufficient within those elementary schools at Plan A.
I do know that there have been a couple of school systems that have had to close down classrooms and/or schools, but it's not been consistent across the board. And, you know, I don't know the specifics around all of those situations to be able to comment on why that might be the case. So I don't have any definitive information that says going completely open for K through 5 is an opportunity for a lot of spread versus doing the split schedule that y'all are talking about doing now. So I can't answer that definitively.
Okay, appreciate it.
Ms. Schitt?
Yes, first, Ms. Harris, I want to thank you for being here. I don't know if I did, and all your support with us and with the schools and what you do every day. This question, I think, though, might be Ms. Ellie. What does staffing look like in terms of teachers returning? And for those who will not be returning, I know that we'll need to look at subs. And do we have subs ready, and have they been trained? And we have the numbers ready to come in. I'm willing to volunteer. I can't sub anymore. I have subbed in schools, but I'm definitely going to be there to volunteer. But what are we looking at in terms of subs and their training to walk in if they have to come in soon because of teachers not coming back or classrooms that have to be quarantined or clusters or whatever? What does that look like right now?
We have a healthy sub pool on record.
On record.
On record. I do know that we have a couple situations we were problem solving around, and we had a fair number of folks that passed on the opportunity to sub. So we will continue to work the sub list and reach out. I would say the second part of your question is we would ensure that as they come in, we get them up to speed around the COVID processes. Our course that we created for staff is also available to subs. So they could very well have taken it prior to getting to us. And we would ensure that minimally they understand the screening process for themselves, how their kids are going to come into their classroom, and what to do should they feel a child is not well, which is some of the training we would provide always, right, about how to handle a sick student. And then we would reinforce as part of the signing in process for the sub themselves, an orientation to the classroom. Here's how the desks are set up. Here's the schedule. Here's how we expect kids to transition. All those things that we would normally do, but with an emphasis on the face coverings, the 6 feet apart, the hand washing, and all the safety protocols.
Ms. Marshall, do you have a third question?
I do not.
Ms. Byers-Bailey, do you have a third question?
Ms. LaShip took part of my question regarding subs, but we have CMS uses subs from 2 sources. We have a sub list of our own, and then we have subs that we've contracted with.
Correct. We have contracted services through Kelly Services, contracted subs.
Are the Kelly subs standing by, ready to come in as well?
There's a healthy pool of subs. I think it is going to depend upon whether, when they get the call, whether it's about availability. Do they feel personally comfortable? Is the location that they're going a familiar? There's going to be all kinds of considerations, but we do have a lot of subs that are both lined up on our sub system for both Kelly Services and our regular sub pool.
Thank you.
Ms. Sawyer, do you have a third question?
Brief one for Ms. Harris. I've heard lots of concerns about lunch in the classroom, and teachers are concerned, and especially since we do have classrooms where social distancing at 6 feet will not be possible. Are there any recommendations for mitigating risk?
Yes, I'll actually, unless I miss something on the safety side. So we have made arrangements for students actually to eat in cafeterias if we know we can social distance them. So schools are looking at their schedules, how many kids they're going to have. And actually, it would be the preference of our food service staff to have them come to the cafeteria. They feel like we can maintain both the quality of the food and the cleanliness of the space. So initially, we were thinking that to provide greater security, that we would want students, because we weren't sure we were going to be able to social distance in the cafeterias. And I do believe in a vast majority, if not all, we do believe with the numbers of kids we're having in at a time, that we could certainly provide that as an option.
Thank you.
Ms.
Yes.
De La Hara, do you have a third question?
Yes, I do, and this is for Ms. Elling. So as you mentioned earlier, we do have one of our metrics up there that's in red, that's a 7-day average, and I know that caused a lot of concern for folks, and you explained, that, and I appreciate it. On our metrics, right under, it says, one or more metrics in red for greater than 14 days, consider virtual learning for all students in collaboration with the Mecklenburg County Public Health. It's very likely that this Friday that our numbers will also put us in the red, that will get us there at 14 days. And I think a lot of the public is wanting to know, what does that look like on Friday when it says that there will be collaboration with Mecklenburg County Public Health? Is that Gibby giving you a call after she's done with her her press conference and the superintendent? I just think what that step is, it would be nice for the public to know how that conversation or consultation will take place.
So the consultation internally is making sure we get our numbers, and then we talk to our district response team, which is a cross-functional team. It's representative of my division, HR, operations, our environmental science folks that are out cleaning schools. And what I feel confident that Gibby can explain better than I can is not just that the case count is in red, but it's the interplay between the case count and the actual positivity, case positivity rate that is a holistic view. We would talk, and then we would talk to the superintendent and say, here's what we are seeing. We would talk it through the cabinet, the superintendent then would pick up the ball and talk with chair, vice chair, and you all would make a decision about, based on our current data, what your recommendation would be.
Wonderful, thank you.
Dr. Jones?
Thank you, hardworking ladies.
That's it?
All right, this is just a simple one. So back in July, when we got together and Dr. Greg Little from Atrium was there, one of the comments that Dr. Little said was that nurses and staff in hospitals didn't seem to be catching COVID from their patients. They seemed to be catching COVID from each other. That pretty much goes along with what you said about people bringing the disease into the schools and sharing it in break rooms. So what is the most important thing? I'm going to give you this little statement. What is the most important thing I could tell our teachers, staff, parents to remind their children? What are the most important things we can tell them? Because the most likely times for them to get COVID is when they aren't following the protocols. So what are the most important things that we could ask our staff to do?
I think, well, obviously, there's the 3 W's. Wear your mask, wait 6 feet, wash your hands. The 2 things that we're adding to that, number 1 is avoid gatherings. So even in the school setting, teachers should not be gathering in the staff lounge for lunch. They should not be, in my department, we still have a lot of staff who are working COVID and are in the office, as well as some of the other services we provide. In our break rooms, there's 1 chair per table. The rest of the chairs have been taken out. There's no option for people to gather. So avoid gatherings. And then the other is to stay home if you're sick. Those are the key things that we need everybody to do. And we need them to do that consistently, whether that's in the school setting or whether that's outside of the school setting.
Thank you so much, because Dr. Little said the break room was where people were getting COVID.
And the break room and then other
gathering
places outside of the setting where you work.
Thank you so much, and both of you, thank you so much for the continued work. It's not done, we've got a long way ahead of us, but we're getting there.
So I'll just close with a, not so much a question, but a comment that, I see out in the community a lot, masks that are slipping down and showing the nose, or maybe just hanging off of, I'm modeling because I'm 6 feet apart from people, or, hanging over the chin. And sometimes the mask slips down under the nose without us even noticing. I've seen it amongst my board members. And I know a lot of us will be volunteering in schools in the next couple of weeks. So just a reminder to all of us to be really just like maybe practice, keep checking, making sure your nose is covered. And if the mask doesn't fit right, tighten it up so that it does fit. I see that at the store. I would not be surprised if we have some schools where that mask is hanging down below the nose. I've gotten some emails complaining about it. So I think this is kind of like we say in other situations, if you see something, say something. Let's not be shy about reminding one another to cover up that nose, whether it's adults or children. I mean, I've seen that amongst adults as much as, if not more so, than children. So just a reminder to us all to the simplest thing, the simplest prevention measure seems to be wearing these masks, but we have to wear them properly. So with that, thank you both for all of these clear answers to questions in what is not a clear time. And thank you for all your hard work. Got to keep, the work that you are both doing is what's going to keep us and our families safe. So thank you for that.
I look forward to the students going back to school next week.
All right. So for our next report, I'm going to turn to the superintendent for an equity report on student wellness.
Thank you, Madam Chair, and I was hoping to thank Gibby and Kathy before they left, but I will, no, you're fine. I do want to still publicly thank them for their report and the discussion that resulted as a result. Tonight, I'm going to welcome Dr. Frank Barnes back to the podium. He's going to kick us off with our student wellness report. This is one of our annual equity reports, and it'll be the third one that the board will be hearing thus far this school year. Given the context of the current pandemic environment, we realize more now than ever how important this information that we're going to share with you tonight is. The report addresses student wellness holistically, looking at student health and well-being through multiple lenses, including social, emotional health, physical wellness, and more. And so before, Dr. Barnes is at the podium, I do want to take this opportunity to just mention that we know this is a difficult time for our students and our families. This pandemic has and continues to have a significant impact on student wellness. And so our commitment is to continue to advocate strongly for our students with our funding partners so that we can emerge from this pandemic even more able to serve the needs of our CMS community. With that, I'm going to turn it over to Dr. Barnes.
Thank you, Mr. Superintendent, Madam Chair, members of the board. Tonight, as you are well aware, in 2019, you revised on Policy ADA, our equity policy. And as part of that policy, you have requested that 6 reports be made annually. Tonight is the third of 6 reports. You received a report on school composition. You received a report on educational opportunities and high expectations, and this is a report on student wellness. I'm about to hand things over to my colleague, Kathy Elling, to remind you that the team that's going to be coming before you today is going to be talking about student wellness, but talk about also inputs, things like programs, individuals who are working in those programs and serving our students, outputs, participation in some of those programs and access to those resources, and then outcomes, things like out-of-school suspensions, absenteeism, talk about it holistically. There'll be a relatively short presentation. It'll be thorough but brief, and then there'll be opportunities for the team to be able to answer your questions. We look forward to being able to entertain your questions. I think Mr. Superintendent articulated well that this is a difficult time and this is quite germane. So with that, I'm going to hand things over to my colleague.
So before we start, we want to make sure that we are grounding ourselves in some of the work we've done with CASEL, which is a collaborative, national collaborative group that has done a lot of work across the country. They came and performed a readiness assessment for us and gave us some strategies. And we want to talk about student wellness in the context of a definition of what that social emotional learning looks like. And you'll see two definitions up here. And recently, CASEL expanded their definition to include from just children. You'll see on the left that the social emotional learning is a process through which all young people and adults, so some of what you're going to hear about tonight focuses on students and the adults that serve them, acquire and apply the knowledge and skills and attitudes to develop healthy identities, personal and collective goals, supportive relationships, and caring decisions. They expand it to talk specifically about the necessity for authentic school-family partnerships in this work, and that they believe, and we do too, that along with comprehensive approach, SEL can address various forms of inequity and empower young people to thrive in their communities and to make positive impacts. This is called the CASEL Wheel, and you can see from the way it's laid out that we're going to talk to you tonight about some specific outcomes, but we're also going to talk a little bit about what we believe are programmatic things that we're doing around SEL to expand the skills that you see listed in the center. We're working so that all of our children have self-awareness, self-management, social awareness, have solid relationship skills, and are able to make solid decisions. And it's important to kind of look at it in terms of it's not just an SEL curriculum that's going to do that. It's school-wide culture, practices around that, authentic partnerships with our community and funders, and learning opportunities. So our approach to this report is going to be organized in this way. We're looking at an outcome of concern, why we believe the problem exists, both from a research standpoint and what we know about Charlotte, and then district actions to address the problem and improve outcomes. So we're going to focus on 4 specific outcomes tonight: out-of-school suspensions, in-school suspensions, attendance and chronic absenteeism, and then you're going to hear about things that we believe would positively impact these, and that's what we're doing around social emotional learning and the connection between physical activity and engagement in school. And then finally, I did skip a slide, my apologies. So I wanted to apologize. So when we're talking data, we're talking very specifically, as called out in the policy, about these demographic groups. And this is our 20-day count from last year. 20-day count is a count that we use for statistical purposes. We report it to the state. It's a number that we use, the state uses to fund us for teacher positions. So we feel it's important to anchor in that number. So you're going to hear data from my colleagues that reflects the demographic groups in our community. And I've shared this is what you're going to hear about specifically. And first up is out-of-school suspensions and Mr. Reggie Coles. And Reggie, there's a wipe right here.
Okay. Gotcha.
Okay.
Thank you. So thank you, Ms. Elling. And as you see, one of the first things that we're going to discuss with this part is out-of-school suspensions and in-school suspensions. There have been a myriad of things that we've done in ways of strategies to implement across the district, and they've been implemented from a number of approaches. And so what we're going to focus on is out-of-school suspensions and in-school suspensions, because all of those approaches attempt to address what we're doing to reduce out-of-school suspensions and in-school suspensions. So the first graph that you see here talks about out-of-school suspensions for the year 2019, 2020. The data that you see shows that our African-American students made up about 73% of those out-of-school suspensions. Specifically, those out-of-school suspensions are speaking around discretionary outcomes, and those are outcomes where schools had the opportunity to maybe choose other outcomes, but they chose suspensions. And so with that data, you see also in comparison to African-American demographic, our Hispanic demographic made up about 16% of that data as well. You can see another area that is of concern is our students with disabilities, made up about 22% of the total out-of-school suspensions. All in all, if you were to add up to all the demographics, 93% of our out-of-school suspensions were given to our non-white demographic, students that don't fall into the white demographic. And again, focusing on students with disabilities, and you can see all the other demographics that are there. The number at the bottom in the box shows the total number of suspensions, which total 14,571. This graph shows what we term disproportionality, where we can see that at the bottom, the legend shows that there's a green line that is very, very faint at the bottom. That's our Asian demographic. The red section shows our African-American demographic. The blue section shows our Hispanic demographic, and then the white section, or the gray section, shows our white demographic. And what this shows is that the large majority of our out-of-school suspensions are given to our African-American demographic. You can see that this is also broken down by grade. And with our out-of-school suspensions, we see a spike in our transition years, that is from 5th grade to 6th grade. And then again, from 8th grade to 9th grade, there's a spike. So we know in our transition years, out-of-school suspensions are given, and that is an area of concern. So we go from there to our in-school suspensions. So again, these are focusing on discretionary outcomes, infractions that take place where in-school suspension was chosen, but other things could have been given to address the infractions that took place. 70% of the total in-school suspensions for 2019-2020 were given to our African-American demographic. You can see our Hispanic demographic made up 17%. Another area of concern that we focus on is our students with disabilities. They made up about 19% of our in-school suspensions that were given. All in all, 92% of our in-school suspensions were given to our minority or our non-white demographic. And you can see in the box at the bottom again, very similar to the slide, 2 slides ago, that the total number of in-school suspensions that were given, 12,367. And this is an in-school suspension graph that shows the data mapped out by demographic and also by grade. And it kind of mirrors what we saw with out-of-school suspensions, that there is a spike in the transition years between 5th grade and 6th grade, and also between 8th grade and 9th grade. Also, the proportionality here, or disproportionality here, the very large majority of our in-school suspensions given to our African-American demographic. And what this shows is that the bottom green section, green section is our Asian. I apologize, you really can't see at the bottom, but the legend is the same. The green section is for our Asian students, the red section for our African-American students, the blue section for our Hispanic students, and then the gray section for our white students. And it shows that with the data, that the research behind this data comes out of the Brookings Institute, and it shows that nationwide, our Black and Hispanic students typically are receiving outcomes, disciplinary outcomes, that are a lot more stringent, a lot stronger than their white peers for minor disbehaviors. So as we move forward, the next section that I want to draw your attention to are the factors that we looked into, and that these factors contribute to disproportionality for out-of-school suspension and in-school suspension. And we're going to look at a few factors. You can see on the slide, I'm not going to read all of them to you. I'll point your attention to just a few. Defining factors that are, one, outside of the school, and then two, inside of the school. Community factors, the most significant one that we found is positive relationship with schools, parents, and students. We found that that's one that's somewhat outside of our locus of control as a school system. The domestic pieces that take place that may contribute to the behaviors that we see that come into the school. And I'll point your attention to the second box over on the right, the school factors. Again, not going to read all of those to you, but some of the most significant ones that we found. Adult implicit bias, and the district has done trainings around implicit bias for a while. Disproportionate racial representation in school, and that research comes out of the Kirwan Institute of Ohio State, and also there's research around that out of Morgan State, Dr. Thurman Bridges, who talks about teacher-student identity, and that being a real important piece in behaviors and misbehaviors that we see that contribute to disproportionality. Also, lack of support and professional development for staff. There's been a lot of talk and discussion around training, trainings that are opt-in or that are chosen to be attended by versus trainings that are mandatory around social and emotional learning and around school culture and climate pieces. Other things that we see that are significant factors, implementation and fidelity of implementation of programs such as MTSS, multi-tiered systems of support in schools, and how they follow through with implementing that with fidelity. Again, the research behind that coming out of the Kirwan Institute and Morgan State University, Dr. Thurman Bridges does a lot of work around that. This piece just kind of talks about the approach that should be taken by school systems, and this basically spells out that school systems that take a very narrow approach or only one single-minded approach, they don't really see much progress in the ways of bettering or advancing or improvement disproportionality with their suspensions. Rather, what we want to do is we want to take a multi-pronged approach that includes intrapersonal, interpersonal, and instructional and at system levels to make sure that we are approaching it from a number of directions to help address disproportionality and out-of-school and school suspensions in the district. Again, that research is coming out of the Kirwan Institute of Ohio State. So one of the things, or several of the things that we'll make note of that talks about our data. This data talks about, I'm sorry, I think I skipped, no, actions to address restorative practices. Restorative practices is one of the things that we have implemented. Restorative practices is a program that helps with social emotional learning and helps the school address it. We have social emotional learning with restorative practices in 53 of our schools, the large majority of those schools being at the elementary K-5 level. We do have some at the K-8 level. We do have some at the traditional middle school, 6-8, and we do have 8 high schools that are participating in restorative practices. That is a good program that we are looking to expand and hopefully be able to get in more schools as it has seen a lot of good advancement and a lot of good improvement with school cultural climate that speaks to out-of-school suspensions. Another piece that we're seeing with that is short-term suspension centers. We are in our 3rd year of short-term suspension centers where students can attend if they are unfortunately out of school suspended. We have 6 of those centers with the collaboration that we have with Parks and Rec, and they let us use 6 of their sites. We're looking to expand that as well. We have been flexible in providing that service virtually as the district went to full virtual. We are looking to implement a plan for when students come back in person that we can also pick up back with that in person. There are a number of sites that we're looking at. One of the sites that we see that may prove beneficial is at SPA, where we have classrooms that we may be able to use with appropriate social distancing. If students do return and unfortunately get suspended, that we can pick up our program with the out-of-school suspension centers and be able to do that for right now, for the time being, in those classrooms at SPA. And then we also have a review of the code of conduct revision, where we have a team that meets annually every year, and that team is comprised of a number of people from principals, assistant principals. We have folks from School Justice Partnership. We have folks from Student Advisory Council, Equity Subcommittee, and we all meet to look at the student code of conduct every year to see what improvements can we make, what changes can we make, how can we make it better, how can we make it more equitable, and those are things that we take a look at. That we have seen, those three things that I mentioned, those have been some of the best things that we have done on a yearly basis. Other things that we have that we look at in the district that we've implemented, you can see here that very recently we've had the short-term OSS appeals. I think Dr. Jones addressed that earlier, the recommended change to the policy where now those short-term suspensions can be appealable between 3 and 10 days. Can be appealed to the principal and to the learning community superintendent. Cultural proficiency training that we do have, diversity and inclusion, that is in the district, and that is something that we've implemented, and folks can take advantage of that. District intervention offerings such as violence is preventable, sexual harassment is preventable, community service that we do have, and that's run through our department, and student discipline behavior support. We also have an opportunity where schools can refer students to those programs. They don't necessarily have to come through a discipline team meeting that our community administrators conduct. Schools can now make those referrals themselves with minor incidents that happen at the school. We have partnerships with a number of outside entities, the Department of Juvenile Justice, the diversion program with CMPD. They work with us very closely, very valuable partnership that we have with them, the Equity Committee, and the School Justice Partnership, which does a lot of work with us in addressing equity and addressing out-of-school suspensions and other concerns that may be brought up. Our transitional support case managers, of which we have 4, and what they do is they give another resource, another area of support for our at-risk students who come from alternative education programs, students who unfortunately may get acquire felonies, or any other referrals that schools may have concerns about, students who are just very at risk. Our transitional support case managers meet and then follow up with those students to make sure that they have every possible need, that they have every possible support that can be addressed to help them right the ship, as it were, for academics and also for behavior. And then our community administrators, again, of which we have 6, 1 for each learning community, they do an excellent job of doing data shares with the learning community superintendents and the schools within those zones, within those learning communities, talking about what suspension data looks like, what the trends are, what the infractions are for each school and for each learning community. They do an excellent job of sharing that out and providing professional development, providing training for administrators. And that's something that is very invaluable. They're looking to increase the frequency of those shares so that schools have even more data that they can utilize and get better at. And then also the partnership that we have with Race Matters for Juvenile Justice, that they provide racial equity trainings for us. And so all of these things that we do, that we've implemented, have seen advancements and improvements in how we've addressed out-of-school suspensions. We've seen a number of out-of-school suspensions drop, most notably when the mandate was put in for K-2 out-of-school suspensions. We saw those numbers drop exponentially. We have seen a steady decline, not as much as we would like, but it's still been a steady decline. So that's good data around out-of-school suspensions overall between 3rd grade and 12th grade. Like a former mentor of mine, Dr. Elva Cooper, used to say, we have to clap real fast for ourselves, but then we got to get right back to work. So this is real good data, but we know that there's a lot more that we can do, a lot more that we can implement, and a lot more that we are willing and able to get to the grindstone and continue to improve and get better. So that is data that we had around out-of-school suspensions and disproportionality. And I hope that's been helpful. I'm going to hand it off to Dr. Katrine Penn, and she's going to give you the next set of information. So thank you. Oh, wait.
I got it. All right, good evening. Thank you for your time tonight. So policy policy ADA identifies average daily attendance and chronic absenteeism as two of the metrics of concern in relation to equity and student wellness. And so average daily attendance is a metric that tells us, on average, on a given day, what percentage of students are counted as present. In 2019-2020, our average daily attendance rate was 94.5%. And while the average attendance rate at elementary schools is slightly higher than at high school, overall, we don't see any significant differences in attendance rate by subgroup. So now we'll talk about chronic absenteeism, which gives us a different story. Chronic absenteeism is a term that describes students who have missed 10% or more of the school year at any given point in time. So for example, if today is the 50th day of school, any student with 5 or more absences would be considered chronically absent. The moment we reach the 60th day of school, if that same student only has 5 absences still, they would no longer be considered chronically absent. And so chronic absenteeism includes any type of absence, including out-of-school suspension, illnesses, and any other reason that a student might miss school. So while chronic absenteeism is harmful at any grade, the most detrimental effects to chronic absenteeism are seen in the early grades when students are learning foundational skills upon which other skills are built. However, the most common time that we see chronic absenteeism is in high school, when students are working to accrue credit towards graduation. And I want to direct your attention back to the data that Reggie just shared about suspension. And so if we know that African American and Hispanic students are being suspended at disproportionate rates, in a sense, those suspensions are contributing to the likelihood of those students being chronically absent. So as a district, our data does not look much different than what we see nationally. And what that is that across the nation, chronic absenteeism rates tend to increase incrementally from elementary school to middle school to high school. When we look at elementary alone, what we see is some stark differences in chronic absenteeism rates by subgroup. So while chronic absenteeism in the elementary grades is lower than the district average, which is at 13.5%, we see that white students have the lowest rates of chronic absenteeism overall for the elementary grades, while students with disabilities as a subgroup, as well as white students, have much higher rates than their white counterparts and their disabled peers. Moving on, let me go back to middle, thank you. When we look at the middle school grades, what we see is that the upward trend continues, and we see even more stark subgroup differences. So now we see Black, Hispanic, students with disabilities, and English learners with rates of chronic absenteeism that are higher than the district average. When we go into high school, that's when things start to look really stark. We have the overall highest rates of chronic absenteeism at the high school level and some of the greatest subgroup disparities. Our English learners are chronically absent at a rate of nearly 29%, followed by students with disabilities, Hispanic students, and Black students. Meanwhile, the white student chronic absenteeism rate is actually slightly lower than middle school's average rate and just 1 percentage point higher than chronic absenteeism at the elementary grades where it's lowest overall. So why are we seeing chronic absenteeism in the rates that we are? Let's look at that. So what we know from research is that chronic absenteeism is a complicated thing. There are a number of different factors that contribute to student attendance and student engagement. Some of these are within our control and some of them are not. On the community side, I'm going to highlight just a couple of the ones that you see here. The first one I'll highlight is the health factor. So we know that living in poverty is literally hard on the body and hard on the mind. And we know that our students who live in poverty are significantly more likely to suffer from asthma, and that asthma is a major contributor to school absences. We also know that children and families who live in poverty are more likely to have unmet mental health needs. And so when we talk about health factors, that contribute to chronic absenteeism. It's not just the health and the circumstances of the student, but also of the family. I would also highlight transportation challenges as a significant concern. Families, while we provide busing, if a family or a student misses the bus, does a family have a car to drive them to school? Do they have gas money to spare to take the trip to school rather than taking the trip to work? And the answer is not always. The other thing I'll highlight with our high school students in mind in particular are different family stressors, including the need for students to work, as well as possibly the need for older students to care for young children or infants at home so that parents can work. So there are a range of community factors that are broadly outside of our control that impact chronic absenteeism. But there's also a whole list of contributing factors that are within our control as a school district. I won't go through each of these, but I will highlight a student's sense of belonging and just how important that is to chronic absenteeism, or to attendance for that matter. And so what do we tell a student, or what are we telling them when they are suspended over and over again? We're telling them maybe that they don't belong here, right? And so students who feel like they don't belong in their schools are less likely to want to go and more likely to be chronically absent. And so when we see Black and brown students being suspended at significantly higher rates, that sends messages not only to those who are experiencing the suspensions, but the others who are seeing it as well. And so when we fail to allow or create a sense of belonging for students, it does have a significant negative impact, not only on those who are being suspended, but others who are seeing it. We also have to question whether or not we have built and addressed the social and emotional needs and skills of our adults in our buildings. And I'll tell you guys, I get emails from principals every day saying that our adults need more social and emotional supports, right? And so when adults' needs are not met, it's very hard for them to meet the social and emotional needs of their students. And again, when students don't feel connected and don't feel, one of our leaders used to say, welcome and expected, they're less likely to attend. Exposure to trauma, I want you to notice, is on both of these boxes. And the reality is that while we tend to think of trauma as happening elsewhere, like in neighborhoods or in homes, it does sometimes happen in school, and it's mostly through interactions with others that are damaging to one's sense of psychological safety or belonging. And so we sometimes expose kids to trauma at school, and that can also negatively impact their engagement, their attendance, and impact our chronic absenteeism rate. And then lastly, we do know that high quality instruction is one of the antidotes to chronic absenteeism. This includes a curriculum that's culturally relevant and supports that help students with disabilities be received as full-fledged members of the school community. So when we know some of the factors contributing to chronic absenteeism, I want to share some of the multiple actions that CMS is taking that is aimed at preventing it. So stopping kids from getting to the point of even being chronically absent. The first is that every CMS school is to have a school-wide attendance plan that outlines practices to monitor daily attendance and respond to early attendance concerns. Additionally, there are other preventative strategies in place, including the adoption of culturally relevant instructional practices such as the L reading curriculum that's now in place K-8, as well as an adult learning focus on anti-racism. When we have students who have reached the point of having a number of absences that is concerning, there are both state mandated protocols and district interventions that are put in place. The state mandated protocols include letters that are sent to the home after 3, 6, and 10 days of unexcused absences. These are a start, but there are also interventions that provide support for these families and students to help build connections to the school that seem to be the most effective, and that's some of what you see listed here. So with that, I'm going to hand off to Kim, who's going to share some information about the physical health activities that we can undertake with our kids.
Good evening, everyone.
I am Dr. Kim Morton, Health and PE Curriculum Specialist. As a district, we recognize the importance of physical wellness and student wellness. We understand that students who are physically active tend to have better grades, school attendance, cognitive performance, and classroom behaviors. Also, we understand that participation in sports has shown to lower dropout rates and disciplinary problems. Most importantly, we understand movement is not a break from learning, it is learning. So therefore, in our district, all elementary students receive physical education instruction. In grades 6 through 8, those students are required to take a health and PE course every year. In high school, students are required for graduation to successfully complete a 1-credit health and PE course. However, beyond those required PE courses, understanding the role of physical wellness and student wellness, our district offers these course electives for middle school and high school students. I won't read all these course names to you, but just looking at the course titles, you can see it is all about lifetime wellness, teaching kids skills to be lifetime, for them to pursue a lifetime habit of being physically, socially, emotionally, and mentally healthy. In our middle school and high school, we have a health education curriculum called Choice-Led Health. This curriculum was designed within CMS, and it was developed to build skills with kids and to develop their health literacy. All students in grades 6 through high school have access to this Choice-Led Health curriculum, and this has been pushed out for the last 3 years in Canvas blueprinting. So every student has opportunity and access to our Choice-Led Health curriculum. A point of pride within our district, a practice that we believe can help reduce chronic absenteeism, it can decrease in-school and out-of-school suspension, is our B3 program. B3 was designed, also known as brain-body behavior, was designed to help elementary students develop the brain and body systems for academic and behavioral improvement through participation in movement, physical exercises, and sensory activities. So all our K-5, all our schools have access to some B3 resources. Those resources consist of our B3 task cards that was created in-house by myself and my 2 colleagues in central office, Keith Kramer and Andrew Romberger. This past year, we launched our B3 at-home cards. As a district, we provided all kindergarten through 2nd grade students iPads, and our B3 at-home cards was fully loaded, that we put them out. We loaded the B3 at-home cards first in the central office before distributing to the students, where students at home can click on an icon and image, and it will take them to our B3 at-home cards for them to practice their B3 activities. Then, to support our schools, to understand the what, why, and how of B3, myself and my 2 colleagues, we provide that full support of the training at our schools so that teachers, administrators understand the rationale behind B3 and some anticipated outcomes through implementing B3 at their schools. In 2018, we were lucky to collaborate with Dr. Lynn Robinson. Dr. Lynn Robinson, she conducted an exploratory study to determine the usefulness and success of B3. Dr. Robinson conducted using observations, interviews, surveys, and focus groups to determine, is this a program that would truly help reduce that chronic absenteeism, increase attendance, decrease in-school and out-school suspensions? And so through some of those survey and focus group questions that she got from teachers and administrators and students, here are some of those open-ended responses that they state the effectiveness of B3. And I'll just read 2 of them off. One teacher made the comment, "This training was very informative and really an eye-opener to many of my student actions and behaviors." A student actually made the comment, "When my mind gets off task, I cross the midline to help me refocus." I'm willing to bet that you guys have been sitting here for about 2.5 hours. You're probably wanting to cross the midline, move, get up, and exercise. Those are the types of things that we want our students for student engagement and to be connected. And like Dr. Penn said, to have a sense of belonging in their school through movement. Thank you.
All right, so Policy ADA does not explicitly name an outcome measure for social and emotional wellness. However, it does include or address social and emotional wellness activities as an imperative. So 3 key actions currently underway include a fully resourced and supported multi-tiered system of support. We use that acronym a lot in the district, and I know that it is a bit of a complicated thing to get a grip on, but what that really means is that we are providing high quality instructional and intervention resources for literacy, math, and behavior, and that they are available in all schools to all staff who are implementing interventions, and that we have professional development and coaching support to help people implement those strategies. Additionally, as MTSS addresses academics and behavior, we've recently reestablished an interdisciplinary leadership team to improve behavior practices for all staff. And again, that is focusing first and primarily on core. What are the day-to-day practices in our schools that support students and staff in having positive pro-social interactions and in building and maintaining a positive school culture and climate? We've also adopted universal screening for social and emotional skills for all students in grades K through 12. And what that means is that beyond just identifying social and emotional skills needs for all students, we're elevating student voice about their school experience as well as their teacher and teacher-student relationships. Finally, we're implementing explicit social and emotional and other life skills instruction for all students. A couple of other things that we've got going on, and I'll highlight just a few of these. One includes offering Reconnect for Resilience to teachers with a special focus on those who work in schools whose attendance zones pull primarily from the public health priority zip codes. Reconnect for Resilience is a trauma-informed schools workshop that not only builds the resilience of staff, but also teaches them strategies to support students. We've done that in partnership with both a state grant and with the Mecklenburg County Health Department's RECAST grant, and we'll continue that work into this year. Another piece I will highlight that focuses again on the core of behavior and what we do for all students is an intensive course called Advanced Classroom Management. And that is a course that targets both those who support teachers, so it's working with administrators, social workers, and psychologists to be able to coach and consult with teachers who are struggling with classroom management. And we're also offering the course this year to new teachers and teachers who are identified as struggling with classroom management. Another component of Policy ADA is about increasing student access to student services staff. We have, as you know, with your support, as well as the support of the Board of County Commissioners, year over year worked to increase the number of counselors, social workers, and psychologists in our schools. And so you can see we've done a really good job chipping away at the ratios, getting them reduced. We are especially pleased and proud of the improvement in ratio for our social workers and our school psychologists, and we continue to work to get those ratios down every year. And so that continues to be something that we are heavily focused on, especially as we work to improve the quality of core, supplemental, and intensive behavioral and emotional supports for students. The last piece that I will share that is very important to recognize is that when we talk about disproportionality, when we talk about equity in these range of very complicated factors that combine to play out negatively in some regards on various subgroups within our population, we cannot do this work alone as a school district. Community partnerships are a must. And so when we look at disciplinary disproportionality as an example, there are both council that every county in North Carolina has, and that council oversees the administration of over $1 million for programming, after-school and weekend programming for youth who are either criminally justice involved or at risk of involvement with the criminal justice system. There are programs like that that are in place in our community that we benefit from and we also partner with. Likewise, when we talk about disciplinary disproportionality, there are district-based programs that involve community partners, such as communities and schools. And likewise, for chronic absenteeism, as we said, there are health factors and there are social factors that impact chronic absenteeism. One example of a health factor that we are all aware of that impacts students, that's kind of a surprising one though, is students' ability to see, to have appropriate acuity for learning. And so we have a partnership with Vision to Learn, who provides free vision screenings and free glasses for children at a number of CMS schools. Likewise, there are social factors that are broadly out of our control. We've got deepening and a new partnership underway with Mecklenburg County Department of Social Services, where we'll be working with them more closely to address some of the family and community factors that negatively impact children's attendance at school. So our community partnerships are critical to some of these factors of equity in student wellness.
You want to click?
Oh.
So we know that there are opportunities that we have to improve our performance. We also know there's challenges. So some of the opportunities that you've heard about are our K-12 screener that we have just put in place across the district using Panorama, our district's focus on racial equity and strengthening our community partners. We also know that as a large district, there are things we're tackling, like entrenched attitudes of suspension. Sending kids home is going to equate to a change in behavior when they come back, and it's going to solve the problem. We know that's not accurate. SEL, while new, is new to us and not fully yet understood or embedded, and we're working on that. We're large. We have 19,000 employees, roughly 9,000 plus teachers. And when you think about scaling professional development in an arena like that, it's complicated, it takes time. But to do it well, we want to be systematic of our approach. And then there's no other thing that's pulled our attention away from this high quality work, and it's working through this pandemic, and it's drawn some of our attention away, and we're getting ready to redirect it back. And so next steps, you heard Co-Train reference that we've established a cross-disciplinary team to strengthen what we're calling core foundational behaviors and skills. And we're going to increase SEL professional development, and we've got expanded offerings coming for SEL curriculum and restorative practices. And we think those will also build upon what we've already got. And I think that's it for us, and we will be glad to take questions that you may have.
All right. Thank you for a good comprehensive update on something that is one of a complex topic with a complex set of structural challenges that we are tasked with solving. That is one of our top priorities as a board and as a district. And so before I turn to questions, I just want to let board members know this Q&A will be more organic. We'll just go in the order that you raise your hands, and feel free to do follow-up questions. Get all the information out that you need to clarify. Just if I don't see you with my peripheral vision being off, just, signal to make sure I see you. Don't take it personally. I saw Ms. Sawyer's hand first, and then Ms. Marshall, and then Ms. Schitt. Oh. Okay, so I'm sorry. But I'll start with Ms. Sawyer.
Thank you. Thank you for the presentation. The new policy revision, which allows for a parental appeal, is a good start, but that's actually after the suspension has already been put in place. What specific actions are we taking to reduce those suspensions? Who is monitoring the data? I'm presuming that not all schools have the same rate of suspension or the same disproportionality. Who is monitoring that? Is that built into a principal's evaluation? Should it be? do we need to remove discretion when it comes to suspensions and hold suspensions for only those behaviors which might cause harm to oneself or others? I mean, we talk about discretionary suspensions being a problem, but we control that. We could make things not discretionary.
So let me start with the questions about the data, who looks at it, and how we have a process for that. And so you are absolutely correct. One of the areas of opportunity for us is to look at what is discretionary and what does discretionary look like. What, by school and across schools and levels. Because a consequence for insubordination at one school may look different than a consequence at another school. So I believe there's some front-end work around case studies, talking it through with principals, letting principals see other principals' data and what's behind the numbers, and some calibration of what really is subordination is one of the first parts. School principals look at their data. You heard Reggie say that community administrators join principals and join learning communities to review data. And I think there was a time where we had a more A to B consequence code. And we believe that to universally apply a consequence also may not be the right strategy, because there's unique circumstances that contribute to the situation the child may have gotten in that should require us to be able to really pull that back and make some decisions based on what actually happened in that instance versus a minimum or mandatory kind of disciplinary situation.
Is there a timetable for?
We've started the work. Go ahead about the discretion. Go ahead, Reg.
About.
So just to kind of add on, with the piece of discretionary infractions and discretionary outcomes that can come with that, what we have allowed in the Rights Responsibilities Handbook is if a student commits, let's say, a level 3 infraction, that there's a mandated, not a mandate, but there is allowances or allotment in there to say if a school feels like a level 2 consequence or level 2 outcome or even a level 1 outcome, they feel that that is more applicable, more appropriate, that they have the wherewithal to apply that. So as Ms. Ellen alluded to, around 2010-11, we had what was called the yellow pages in the Code of Conduct, which was these are the most harsh, more egregious offenses, in that if this happened, this is what you got across the board. And it led to consistency, but parents and principals at that time felt like it was too stringent, because I may have a kid that this may be the first time and I'm boxed into one particular outcome that I have to give that is in the Rights Responsibilities Handbook. So what we've allowed is a range of consequences for pretty much each infraction, to where if you see some things that allows you to go down to a level 2 outcome or a level 1 outcome, you can apply that along with intervention-based strategies or other programs that we have that can help teach the better behavior and not just be so punitive.
But how are we keeping schools from, overusing out-of-school suspensions or in-school suspensions for that matter?
I think you were going to ask, Carol, I may have missed that. I think you were starting down, like, what's getting started, like what work have we started? And so this summer, it was July 10th, I believe, or 17th, we convened across a group of principals that really have instituted some really good practices around student discipline, and some that needed to learn some other practices. And they were very eager and excited to talk about discretionary suspensions. What does that look like? What does that mean? And we did a data review with them. So it is my expectation that learning community superintendents are monitoring suspensions, and that they are looking at that. The community administrators help them with that, and then they're working with principals to improve that metric. So when we were talking this summer, I'm looking at our superintendent, we talked about reducing out-of-school suspensions by 20%. We think that's a doable goal. And we think that it's not just not suspending, but it's doing all the other things on the proactive and education side that make that a sustainable strategy, because people will have learned how to manage classrooms, how to handle, and there'll be a developmental consequence kind of scale, which is in the Code of Conduct, that is universally known and executed.
Does that 20% reduction also address reducing disproportionality as a goal?
Yes.
What is the metric on that goal?
Yeah, we targeted a 20% reduction, and I'm working with Dr. Barnes and his team to look at a more sophisticated metric around disproportionality and what would it look like to knock that down. We think a 20% reduction obviously would have an impact on that, but it wouldn't necessarily be the total impact because we could still potentially be disproportionate with that.
Right, because I think our pre-K2 are still disproportionate, even though the numbers are down.
Yes, potentially, yes.
Thank you.
Okay, Ms. Marshall, and then I'm just going to go through the list. Ms. Marshall, then Ms. Shipp, then Dr. Jones, and then Ms.
I appreciate the full-bodiedness of this presentation, looking at the whole child, the child that brings themselves in terms of attendance and ability to be present every day, and their heart, what's in their social emotional piece, and the trauma that they may be bringing, their body, and what you've addressed in terms of how that can really improve student wellness. And then, of course, all this affects their mind and what we do. One thing that has interested me, troubled me, is to see this spike in 6th grade and 9th grade in attendance and in really not attendance, but really in suspensions. And what that, certainly how the impact then that has on attendance. And you see that 6th grader getting in bad habits and things and the messages that are sent to them, and then that just seems to grow exponentially by the time they're getting to high school. I want to ask you about restorative practices. And I know we had talked about some things that seem to be helpful in that. And is that one of the main things you're doing to address the 6th grade and the 9th grade sort of spike in this suspension data?
Right. So one of the main things restorative practices does is it kind of, what I term it humanizes an infraction. So what it does is it allows the staff to be able to see that this is not just a robotic infraction that happened and we're focusing only on what happened and the outcome. There are people that were involved in this, and somebody was harmed, somebody did harm. So what do we do to repair the harm? In other words, there's a person that you offended in some type of way, whether it be verbally, physically, or otherwise. What are we doing to acknowledge the feelings of that person, to repair that harm, and to humanize it to where we repair the harm, and that when we come back, that there's a comfort level around being being around a person that harmed you and being around a person that was harmed. And how do we repair that harm? So restorative practices, what it does is focuses on building relationships to where it betters the school culture and climate. And we talk about lowering suspensions. The real focus of restorative practices is reducing the number of infractions. So if you don't have those number of infractions as a result of building relationships and improving culture and climate, then you won't have to worry about suspensions on the back end. And so what restorative practices, what we've seen, and we've been working with Dr. Frank Barnes and accountability, doing an effective assessment on what is the real impact of restorative practices schools versus schools that don't have it. And what we're seeing so far, because we haven't finished that assessment, but what we're seeing so far is that schools that have implemented at least parts of restorative practices or the whole restorative practice program, they've seen a significant increase in positive school culture, positive school climate, and they've seen an increase in students recognizing that there's a human being that is harmed and there's one that's dealing harm and that's been harmed, and that we have to acknowledge repairing those relationships. And so when we compare those schools that have it and those schools that don't, we know that restorative practices is not the panacea, the end-all be-all, and that solves all suspension problems. That's clearly not the case, but we know that there's a significant part in seeing a decrease not only in suspensions, but the initial infractions that take place, which then you see a decrease in the suspensions. Okay. So it's a very beneficial program, and as Ms. Evans said, we're looking at all opportunities to be able to expand it somehow to all of the schools.
I would love to see that happen. So, yeah, with great haste, that would be great. Thank you.
Ms. Shipp.
Yes, this has been just so thorough and so comprehensive, so I want to thank you all for this, because student wellness and this equity report, this is so important. I'm looking at though again, and they go together, is the sense of chronic absenteeism and suspensions as well. And so this is an area that I think the schools need a lot more support to look at absenteeisms. As you talked about, I guess, Maslow's hierarchy of needs, which is that sense of belonging and everything that goes with it, that has a lot to do with attendance, chronic absenteeism. And I think one of the things that's a struggle is working with Maslow's hierarchy of needs and Bloom's taxonomy, right? The academics versus this sense of SEL, right? And so I guess my question is, how do we continue to try to balance this? Because we have so many great things we want to do, brain breaks. We talk about class meetings. We talk about restorative practices. How does the school balance it all when we're talking about this academic day where we really want to get kids prepared for testing? And I've seen just myself being in the school, that was the balance. And having enough staff, social workers and psychologists to help with this. How do we balance this? Because I think this is a real issue.
I love this question because there's a couple things that strike me. I think we have inappropriately juxtaposed Bloom's against Maslow's when I think you actually can do both.
Right.
And you have to excel. So Bloom's, is the taxonomy of how you're thinking and sophistication, and Maslow is, are you safe, are you secure to be able to access the learning? And so we need to do both. And there's really quick strategies woven into the day that create those connections for kids, so that does open them up to learn. I think one of the things, Lenora, when you and I were principals around the same time, we were struggling, I think I was struggling because we looked at things as isolate blocks of learning. And so it was just how much more blocks can you cram into the day versus how do I incorporate movement into the math? How do I incorporate kids turning and talking and being able to express their feelings as part of social studies, as part of ELA? So I think it's helping principals and teachers develop integrated lessons and units of instruction that weave these things in. And by the way, that's the way we learn. It works better if it's connected and not in isolated chunks. So I'm not going to say it's not a challenge because we have a finite amount of time, but it can be done. It is being done in schools, and teachers are eager for it. Principals are eager for it. We just have to sit with them and show them the way so they don't feel they're compromising.
That's right. And I have a question about, and I think it was mentioned maybe in restorative practices, this need for intense classroom management training. This is a lot to do with suspensions and understanding what targets behaviors as we look at culture and race and equity and justice, because a teacher really has to have skills to deal with this so that we are not referring students, which leads again to suspensions. So how are we doing that in terms of professional development and the amount of time spent ensuring that teachers have this training?
So thank you for that question. One of the things that we are most excited about as far as this content is that it is a 20-hour course that takes place over the course of 3 months. And so you're learning a skill set, you're going back, you're practicing it, you're coming back to training again to troubleshoot and to get feedback, and then you're going out and practicing again and coming back one more time to get coaching and support from our trainer. We're working with Winthrop University on this course. On the consultative piece, one thing that we've heard from administrators, I think there's a tendency, because our teachers don't get a lot of training in their education programs on classroom management, people who are good at classroom management are sent to coach other teachers who are struggling with it. But often the teachers who are good have a hard time articulating why it is that they're good, right? And it makes it hard to teach others how to improve classroom management. And so we felt it was important to not only have a course for teachers, but to have a component that is specifically for administrators, social workers, and psychologists, so that they can consult with teachers who may not have an opportunity to go to the course, but learn how to help others develop and improve their classroom management skills.
That's great. So much needed. Thank you. for that.
Dr. Jones?
Thank you. I know the statement was made that SEL is new. I would suggest we just haven't chosen to address it. I can assure you it's not new. About probably 20 years ago, 15, 20 years ago, I was working at DPI, and we had a specialist. I can hear you. Okay.
Move the mic closer.
We had a specialist from England, and he came and he talked about what they did with young people. The testing that Ms. Shipp mentioned, we sit children down and pump their heads with factoids. Where there, they engage children in that brain, body, behavior. They know that when children come into school, they slept all night or whatever, they need to be moving, not crisscross applesaucing. Or whatever it's called. So I think if you paid attention to JKD that have been passed, please study it and put it into application. Don't just let it become a policy, because it's some good recommendations here. And so I don't want next year you to come back with a report on this dismal report on black children being suspended. You aren't teaching them the way they need to learn. They like movement. And so it's a cross between the instructional methodology and these social emotional learning. It's intertwined.
Okay. Do you have a question, or?
No.
Okay. Your point was very well taken, and no question needed.
Took it in, and we're ready.
Ms. Byers-Bailey, and then Ms. Cheek.
Thank you. I've had a conversation with a high school teacher, and I think this is when you all first started this, and everybody was focused on getting the numbers of in-school and out-of-school suspensions down. And she was completely frustrated because she was having issues. If she had an issue with a student and she sent them out for a referral, and once this bring the numbers down, it was like, okay, so you just sent him back and there was no consequence to his behavior, so he just felt like he got away with something, and now he's more emboldened to do even worse, behave even worse. I can see a lot of things that you put in place to make, to remedy that response, but are you still having teachers who are frustrated because they can't seem to get across to the kid that's continuing to be disruptive because nothing's happening to them because they're being disruptive, they just get to come back to class?
Yeah. Yeah, Reggie's gonna, the answer is yes. And Reggie's gonna share. You got something to share?
And the work around that is where the training will come in around mindset shift. Whereas teachers that are in classrooms that for so long have felt like or have been indoctrinated to suspension, again, being the panacea, the end-all be-all, that if I refer this student is going to be removed from my class, and then they'll learn that lesson as a result of missing out on school. The mindset shift comes with training, and the more training that we can get teachers to, the more that we can shift that mindset to where out-of-school suspension is not going to be always the outcome, that there may be a student who may be able to be addressed in your classroom with more skill sets that you have to be able to address that misbehavior, teach the better behavior, and then continue your lesson. That way it doesn't result in a referral. And if, unfortunately, that student has to be removed from your class, that there are intervention-based strategies that we're going to do. They may last 15 minutes, they may last the whole period, or what have you, but there is a heightened chance that that student gets those intervention-based strategies and then gets reintroduced back to your classroom, having learned the lesson, having been taught the preferred behavior, and then that the teacher understands that simply because they are returned and reintegrated back into the classroom, they're not quote unquote getting away with something, but the student has learned what is preferred without being without being suspended, and then that being negatively impacted on their exposure to instructional time. So the mindset that you speak of, where teachers are feeling like students are not getting their quote unquote just due because they're not removed from the classroom, that is a training piece that we look to address, and there's a mindset shift that with more training, that mindset will shift, and they understand that there are other outcomes other than suspension.
Is that something that you see more in high schools, or is it all across elementary, middle school too?
Sure, and I think the question was asked about the transition years, the 5th to 6th grade and the 8th to 9th grade, and it seems that the higher the student gets in academics, the less and less tolerant teachers and administrators are for some negative behaviors, and that the notion around mindset is, well, by the time you get to this level, you should know better. Okay. And we had discussions around, whereas a 5th grader, I displayed some behavior and maybe the counselor or somebody talked to me and I got sent back to class and that was okay. In middle school, well, you better know better because this is a different level, and if you do this, you'll get suspended for it. And then even more so at high school, and we talked about the mindset about time. The notion or the misperception that I only have a certain amount of time to teach this material, and I can't tolerate misbehaviors, and it's not our place to teach better behavior. It's not our place. We just have to teach curricular pieces, instructional pieces, and be academically focused. That, again, the easy and low-hanging fruit thing to do for teachers is to write a referral, and then by extension, the easy and low-hanging fruit thing for administration to do is to suspend. Again, a mindset shift that's going to shift with training, and once we change that mindset, we'll start to see better relationship building, better school culture and climate, and then the reduction in those infractions.
Thank you.
Ms. Cheek, and then Mr. Schul.
Yeah, just a few comments and a question, I hope, more than Dr. Jones' question. That'll be maybe less. What you just said, I wrote it down, the mindset shift. I knew when I was at South Meck High School back in 1979 that when you got suspended that it was really fun and you got to get high and hang out with your friends. Now, I personally didn't do that, but I know people that did.
So you heard.
So I heard. No, I mean, I never got suspended, so it was not me. But I do know that that's what people did. And it was big party time. And I had a child that got suspended from North Meck High School that some of you might remember from 2009 or 2010. And she thought it was going to be big fun too, and I made it not very fun. And she actually went to what was Turning Point then and did some other things. It's a mindset shift though. That was just the knee-jerk reaction. We're going to send them to the office and they're going to get referred and they're going to get suspended. Boom, they're done. And then nobody thinks about what's going to happen. So the mindset shift to me is such a huge thing for everybody. And it's not just for the staff. It's for parents, because everybody on this dais here knows that when some kind of event has happened at a school, we get letters from parents. They want to know what happened to that kid that did such and such. We don't ever tell them, but they want to, they better have gotten suspended. They better have gotten suspended, so we always hear that from families. So however we can make the mindset shift happen, it needs to also happen in the community and outside. And our community partners are key, but not just that, but just the community in general. So the media partners that are listening right now, we need them to buy into this and help us. Now, as far as you and the Wiggles. So, while you were standing here, I actually left and went outside and I jumped around, and I didn't even intentionally do that. But, well, I did, because my watch kept vibrating, telling me I'd been sitting too long and I needed to go move, because my watch tells me that every so often. So I know that a lot of our schools have adopted movement programs and very active programs. So are you working with them as well on their, and it's very specific, specifically I have Grand Oak and Huntersville Elementary that have very big programs going on in their schools right now.
Yes, so B3, brain body behavior, has grown organically for the last 4 years. The 2 schools that you mentioned, Grand Oak, Huntersville, Torrance Creek,
Those
there's
are all
so
my
many
schools.
other schools I can name too. They started early in the program. We worked with the principal. Actually, it was a we, not me type of approach. We looked at their school improvement plan. We looked specifically at their data to say, okay, what target things can we do with B3 to help their school meet their goals? And so fortunately, we had some early adopters. Those early adopter schools, principals, are now becoming the leaders of showing other schools, and other schools are going to visit their schools and say, show me these active hallways, show me these B3 labs, show me how classroom teachers are intentionally doing B3 activities to help prevent the misbehaviors from occurring from the first place. And an outcome of the B3 training is that teachers have a better mindset of understanding the actions behind when a student misbehaves. Understanding the trauma of misbehavior too, that a student who has high adverse childhood experiences are going to be 32 times more likely to have behavior problems. But through movement and connecting with a caring adult and nurturing adult is going to help reduce that trauma. So, well, it's going to help cope with trauma. It's not going to reduce, it's going to cope, and the skills. And the greatest outcome with B3 too is that kids learn to self-manage their emotions and self-regulate. So the schools that you mentioned were some of, like I said, some of the early adopters, and hopefully some of our principals that are watching are giving a high five saying, yes, come to my school, and they are so happy for any tours of B3 if you want to go see for yourself.
They're all great, and I would say not just cope, but maybe to help to neutralize some of the effects of trauma.
That's correct.
To neutralize it, and that's what we have to do. I have a college student now. He graduated from Huff, and he was struggling the other night to get ready for something, and he was just very stressed. And I literally said to him, put down everything, close your laptop right now, and go downstairs and run around and come back up, and you'll feel a lot better. And he texted me, he goes, thank you for reminding me that I have to go move when so it's true, and it's for all ages, but just thank you for moving this program forward. People don't understand it. We have a lot of community members that still see desks lined up in rows and thinks kids are supposed to sit still for 8 hours straight and then get on the bus and go home. That is not what's best thinking today, and that is not, we need a mindset shift on that behavior as well.
Thank you.
Thanks.
I want to put a bow on what you shared, because part of the structure of our report was to call out specifically that we're just not going after some discrete outcomes, but it is a holistic approach, whole child approach based in research from our friends at Castle, and it'll address, done systematically with a cross-functional team, will address lots of outcomes in a positive way.
Okay. Mr. Shule?
So thank you for the report. I think one of the takeaway from the experiences of students is that norms of what we consider correct behavior are rooted in bias. And even the Skiba and Metadorada study that's cited in the slides talks about how there's culturally dominant judgments in things like dress, speech, tone, et cetera, which determine like what we call disruptive or defiant. That's especially frightening considering that Rule 9 of the CMS Code of Conduct specifically talks about generally disruptive behaviors and associates level 3 consequences potentially. So to me, that alone would justify eliminating the possibility of a level 3 consequence for something as vague as a generally disruptive behavior. So I guess the larger question is, what kind of initiatives and thought have we put into eliminating the possibility of level 3 and above consequences for such a wide range of disruptions?
Sure, thank you for that.
Mr. Coles, can I just
Sure.
take a quick first stab at that really quickly? And I want to acknowledge, Mr. Schul, you and your colleagues, our students, because I think what we're talking about tonight really does get down at the end of the day about the student experience. And so when students are chronically absent, when they're being suspended at disproportionate rates, then students aren't having that experience that we intend for them to have. And so you and your colleagues, we've made it a point. I know Madam Chair and I met earlier this school year,
July.
actually over the summer,
Summer.
with students asking your opinions about your experience. And we also follow that up with asking you all to review the Code of Student Conduct Handbook. And you all have made some very good recommendations that were incorporated through that cross-functional process. So I want to thank you all for that work. And that's one of the things that we want to continue to emphasize, is to make sure that students are an integral part of that process, because ultimately all of this affects students. And it's incumbent upon us to bring you to the table as part of that decision-making process. And quite frankly, that's how we got to, Dr. Jones, the policy that you read tonight for the first reading. It was because of your input, your colleagues' input. So we want to continue to see that happen.
Mm-hmm. And I can confidently say that CMS does a good job of engaging with students on those experiences, and I appreciate those initiatives. But like you said, it's a continual process, and I think specifically those questions of generally disruptive were, somewhat reflected in the initial concerns that we had as well.
The work continues.
Yeah.
Was there more to respond? Was that
I
enough
think-
of a
okay.
response, or did you need more?
I'd like if there was just more initiatives about whether we were planning on eliminating level 3 and above consequences for like wide ranges of disciplinary.
Well, what I can tell you is being one of the members of that review committee of the Rights and Responsibilities Handbook every year, is that what you have brought up is a very good suggestion. We specifically, from the students who have participated on that committee, have not heard that concern from them specifically to eliminate level 3. I think that would be a good consideration. What I will say about Rule 9 is that the bias pieces that you mentioned around like tone and dress and generally disruptive behavior, before it gets to that level, all of those things are reviewed by our MTSS specialists in the individual learning community. So before a student can be considered for any type of serious outcome, either exclusionary for suspension or anything higher than suspension, exclusion or expulsion, those things have to be reviewed. And so that's the catch-all, kind of the checks and balances system by the MTSS specialist and the learning community administrator to say, hey, listen, before you consider this, have you considered, is there bias in this? Well, what is really disruptive? Is it a student just getting out of line? And you saw that as disruptive? That's easily corrected. Is a student, because they know the question, they raise it, but they yell out before they raise their hand and acknowledge, that's disruptive, but that's easily corrected. Why has this risen to this level? And then there's a checks and balance system to say, hey, these are some intervention-based strategies that you missed that you might be able to implement to help the student. And then there's progress monitoring of that data before you get to exclusionary pieces like suspension. Try these intervention-based strategies, and then that way we don't even get to a level 2, much less a level 3. So with Rule 9, there's some checks and balances in there that we can pay attention to those biases that you mentioned. And if schools are doing that with fidelity, then we really don't reach that level. But I do take that suggestion as being a very valid suggestion that has a lot of credence to say, hey, we may need to take a look at, is level 3 even applicable here? And that's something that if the next Rights Responsibilities Handbook review committee that we have, if they want to bring that up, we'll definitely address it.
Mm-hmm. Thank you. I'll probably follow up with that specific concern. Then I also wanted to talk about, and this comes from a lot of students that I've talked to and a lot of growing body of evidence suggesting that specifically black female students get labeled as loud or having attitude, which contributes to a disproportionate amount of suspension. So I was wondering if we were going to get any data that's divided by gender.
Yeah, we are looking at data by gender. specifically around the first thing that I mentioned, which is what is discretionary and what does that look like. So that will be a part of the analysis that we're looking at this year with principals.
Okay, thank you. And then similar to that, there's also a growing body of evidence suggesting that lesbian, bisexual, gay, and transgender students are at heightened risk of OSS and ISS because they defy behavioral expectations and assumptions. So I was wondering, do we have any part of our professional development training which is specifically geared towards LGBTQ plus students?
We, for obvious reasons, we don't track students' sexual identity or sexual orientation, right? Or gender identity for that matter. And so we would not be able to speak, like to pull that data set specifically. I think what we could look at with our accountability department that would be very interesting is with the Youth Risk Behavior Survey, that does collect and ask some questions about sexual identity and gender identity, and it asks questions about school experiences, about bullying, about discipline. And so
I should have clarified. I'm not suggesting like collecting data.
No.
I'm saying like professional development or the.
Oh, okay. So I was answering a different question, which is, do we know based on data whether or not this might be a problem? And I do think using Youth Risk Behavior Survey data, we could get a sense of whether or not this may be something that looks like an elevated issue within Mecklenburg County. We have our bullying prevention specialist. We're actually in the middle of changing his job title to bullying prevention and LGBTQ support specialist. So we do have a staff member in the district who oversees gender support plans as well as professional development, consultation, and team support to address the needs of LGBTQ students. And so I would certainly invite and remind schools that that support is there. When we, as we've talked about student voice a lot, when schools are hearing this as an issue in their building, we do have staff to support. And we also work regularly with Time Out Youth.
Thank you. I just think that I'd like to see an increased amount of attention devoted, especially to professional development and how teachers are trained to expect that bias. Then I also wanted to talk about something that I have brought up in recommendations to the Code of Conduct and also outside of meetings as well, specifically with regard to hate speech, because and I know this, again, seems like a somewhat specific concern, but if we're looking at like Rule 8, it's about bullying, and it specifically talks about how you can't have discriminatory or offensive language in the case of bullying. So absent an explicit target, hate speech isn't explicitly defined as something that we can discipline. So I'm wondering if there's a possibility of including provisions talking about hate speech as a whole within schools, and that way teachers don't have to default to their own discretion.
So that would be another suggestion to bring to the committee that reviews it, and if that is brought up by a student who is representative on that committee, or if they want to bring that up through another party as a suggestion, that's something that we can look at the wording right now. There's talk around what's the versus between offensive and harassing, because there's some vagueness around anything could be offensive. What could be very well considered normal could be offensive to this person, but harassing is a little bit more clear. Hate speech is something that could be brought up as a suggestion as we review the next committee date that we convene to review for the Rights Responsibilities Handbook. That would be a good suggestion also to bring up.
Thank you. And then last thing, I know we talked about like this explicit SEL teaching. To my understanding, that's something that's unique to remote learning as we've implemented it now. So I don't remember that happening beforehand. So can you guys elaborate on how that would be implemented in an in-person setting?
So explicit social and emotional learning is not unique to the online learning environment that we are in right now. By happenstance, we expanded to all schools this summer without knowing for sure that we would be in a full remote stance. So many of our schools were already implementing explicit social and emotional learning, K through 8. Some of our 9 through 12 schools have been implementing programming such as Sources of Strength. And so what we saw this year, or what we're seeing this fall, it certainly feels like it's associated directly with remote learning, but that's more so just around the timing of when the implementation of explicit SEL ramped up to district-wide.
Okay, so there would be some time set aside during in-person learning for it?
That is currently the plan, that high schools, so our elementary schools and middle schools have roughly 40 to 45 minutes set aside daily for social and emotional activities. And some schools also integrate health and movement as well as intervention during that time. Same thing for high school when we return to a face-to-face environment.
And I will just add to that, the feedback that's come with this latest week's round of social emotional learning, specifically on social justice, has been overwhelmingly positive. Except that there are some complaints about teachers, modifying or not teaching that curriculum as it should be.
Well, and I appreciate hearing that feedback. We have a team of, so at the high school level right now, we are actually in the very beginning stages of a curriculum adoption process for high school curriculum. We have a K-8 curriculum for social and emotional learning. At high school, we are looking for something that will address social and emotional skills and the application of those skills, which is where the social justice comes in, as well as college and career readiness skills. I follow our Generation Nation and our youth on Instagram, and so I know what you guys are wanting, but we wanted to get there in a way that allowed time and opportunity to get used to the advisory block setting first before we delved into these challenging topics. So I'm happy to hear that the feedback has been good.
Just for the social justice.
I understand.
So before I go to Ms. De La Hara, I just want to acknowledge that our student advisor, Gabe, just turned 18 this week. So happy birthday, and he has exercised his right to vote. And it's just 17 more years until he can run for president. So Ms. De La Hara?
Thank you all so much for your presentation today. I just have a quick question. This just happened to come my way this week, and I'm still putting the pieces together, so I thought I'd just bring it up here. I found out of a particular high school that's partnering with this organization for 2 years to provide I'm reading what the principal's note says, to provide a multifaceted educational platform to schools and businesses promoting diversity and inclusion to develop competent, compassionate, and active global citizens. They're going to be working with staff, students, and parents. And when I saw that, it sounded really great, and it still does. So I inquired, how does that come to be? Is that a principal making his or her own decision using discretionary funds or whatever? And through that inquiry process, I found out that that was done through our diversity and inclusion department. And so I guess my question then is, this is a new program, and they did confirm it's the only school using this particular program. What can you describe at all? And if you can't, maybe Ms. Lloyd can later, what the process is for, because they're just embarking upon this new relationship, for evaluation of such a program, because maybe it's great and maybe we want to expand it to other schools, or maybe we find out for whatever reason it's not. And I'm just wanting to understand from an oversight standpoint, how do we go about, instituting these new programs, since you put D&I up on your initiative list, and how that goes about being expanded, or maybe just nixed because it doesn't, pass the grade, if you will.
So just a conversation that happened just today with Ms. Lindsay Messenger in accountability. One of the things that she suggested is that when schools, principals, however you come about these programs that you want to implement in your school, if they are included from the onset, to be able to get data and see the progression of that program in that building, to be able to do the assessment to see the value add to that building and the value add to that school culture and climate. That way it's not a year, 2 years, 3 years down the road and they're saying, oh, this was great. Now let's go back and in retrospect find all of the data to see how impactful it was and then compare it against schools that didn't have that program. So what I would suggest is just to kind of follow up on what her suggestion earlier is that if you want to see the impact when you find something that you feel like is going to be good for your school, include the Department of Accountability so that they can assess it as you go along and see the value add. And as you go along and say, hey, this high school did this, it was very impactful, and if there's another school of similar demographic or if there's another school that's looking for something like that, here's an idea that we've been following since the onset of the implementation at this school. And so how they go about finding it, principals find things all the time, and then they say, hey, I think this would be good for our school. But I think that would be a crucial point to add the Department of Accountability to really dive into the assessment of the value
So
add.
who should add the department? Like, should the principal individually
think
be
the
going to
yes,
them?
the
Okay.
principal should say,
Or
hey,
would that be something that the Department of Diversity and Inclusion would suggest to them as that approach?
I think it could be both.
Both?
I do
Okay.
think that is we do need to do more systematic program evaluation from the onset. I also think that it's important that as principals encounter the next great thing, that they run it through either learning and teaching, or in this case, they ran it through the diversity inclusion. And sometimes we get ideas thrown to us and Co-Train's team vets them against current research. Does it align with our district's framework for instruction, things like that? So I don't want us to chase on the next best thing, but I want it, when we're out there, we do need to cull good ideas and run them through our teams that should be vetting that to help schools make good decisions.
Absolutely. Okay, thank you.
All right, I just have a couple of questions. First, in this really comprehensive report, we just lightly touched upon the panorama screener, and I'm wondering if you could share for my colleagues and for the public just a little bit more on what the panorama screener is, where we are with that, and when we expect to see some data from that.
Thank you. So some of you may remember about 2 years ago, we updated the wellness policy for CMS. And within that policy, we determined that we would conduct universal screening for behavior in this district. After we did that policy update, we started piloting. Well, first we conducted a vendor review process, and we selected Panorama as a universal screener for piloting. We've been piloting for 2 years, and this summer we received funding to be able to go district-wide. We felt like this was a particularly important time to be able to have a better understanding of our students' social and emotional needs. So what Panorama is, and actually I'm gonna go back in the presentation a while. What Panorama is, it is not a mental health screener. I wanna say that over and over again, help me scream it from the rooftops. It is not a mental health screener. Panorama is a student survey that asks students questions about how they view their skills at self-management, responsible decision-making, relationship skills, social awareness, and self-awareness, and it asks them questions about their relationships with their teachers and their school environment, how they feel about the climate and culture in their school. And so the way that the data in Panorama comes back, you have really 3 different levels of data. For those of us who are central office, there's the district-wide data where Superintendent Winston will be able to look at Panorama and see, based on a nationally normed data set, where are our students viewing their self-management skills compared to others their age nationally. If that is an area where we are low, what I can tell you is that self-management has a very high correlation with academic achievement and with discipline. So if we are lower than the national average as a district there, we've got to focus some attention there, right? So, and likewise, we get a school level report, a classroom level report, and individual student reports. And so it will allow us not only to understand our district level social and emotional needs for all students, but by school, by grade level, and by class, what we might want to focus in on in core, okay? It will also, because it is nationally normed, it will help us to understand who some of our students are that I like to reference as our students who are suffering silently. We know who the kids are that are standing out because of externalizing behavior, right? Those are the kids who are doing things that sometimes lead to suspension or other disciplinary referrals. We miss the kids who rate themselves as having a lot of difficulty building relationships with students, or who feel like their teachers don't acknowledge them, or, we miss those kids right now. And so Panorama will also help us to understand who those kids are who are struggling with any of these areas more than the typical student in their school, in their grade level, in their demographic. So does that help? Oh, and where are we right now? The 19th of October, we finished surveying the whole district. And as of this week, schools are getting training on how to access and interpret their data. We will look at district-wide data next week for the first time.
And the data can be broken down by demographics, right?
It can.
And so if you have a school where, for example, you have students of color who say they don't feel heard, or their concerns are not being heard, or they're being treated differently, and then this, and administrators might be saying, but no, that's not happening. This will help us really hone in on showing, on elevating that and showing
Absolutely.
very specifically at a school level or even at a classroom level where we have work to do.
It does, and we've talked a lot about student voice. One of the things we love about Panorama is that because it is a student survey, it's one of those situations where we have to be able to look at that data and say, if this is what our kids are telling us, we have to believe them, right? And it does demand a response, and that's one of the things that our pilot schools have really loved about Panorama, is that it's very actionable data and easy to understand.
Okay, thank you. So my last question, this might be ending on a sober note, but asking about the chronic absenteeism. And do we know, so with everything equity related, we know that COVID is, whether it's the economic impact or the healthcare impact of COVID, it is impacting our community disproportionately. And I wonder if we're seeing that with our chronic absentee numbers thus far this school year. I know in the spring when we shut down schools, we did not have to take attendance. This fall, as we've been doing remote schooling, we are taking attendance. And I'm wondering if you have a sense, and you may not be prepared, I didn't let you know in advance I'd be asking this, so if you don't have the data, I understand, but do we have a sense of, are the chronic absenteeism numbers trending the same as far as volume as well and disproportionality? Are they shifting with kids learning from home?
So what I can tell you definitively is chronic absenteeism is up this year. I looked at the data about a month ago, and the number is not registering for me, so I apologize for that. But I do know that chronic absenteeism is up this year. I cannot speak to subgroup data at this point in time.
Okay, thank you. All right. Well, just thank you for, I actually want to thank my colleagues for a really rich conversation on some incredibly important work. And clearly, we have our work cut out for us. We've had our work cut out for us since long before any of us even served on this board. But I really feel like we're starting to get somewhere. And I look forward to better results, improved results when we have this report again next year. So thank you again very much. Oh, I'm sorry, Ms. Shipp, did you have one more question?
Yeah, I just wanted to share this, and I think many of you all know that many of us attended the Urban Council of Greater City Schools Conference. And when we talk about student voice, it was wonderful to attend the student forum where Gabe was a part of that. I actually listened to that entire session, and I think you may have known that because I made comments, right, in the chat box. And it just really made me aware of how important the student voice is all over the country. There were students from everywhere talking about how they felt, especially high school students, about how they felt about school. And they were talking a lot about equity and racial injustice, and how do we deal with that, and issues that come up. And when you mentioned about the girls, black girls, and how they felt, one student expressed the situation she had in the school and how it affected her, and how she would go on, you know, in terms of her academics. So I think it was just wonderful to hear that, and to know how important it is that we listen to the student's voice, that we have this social emotional learning and equity, because this is everywhere. It's happening everywhere, and it's such a great need. And I just wanted to compliment you for your work and what a great job you did. And it was wonderful to hear all the students from all over talk about this actual issue we're talking about, or this concern we're talking about tonight. It was really good. Thank you.
Well, on that note, I will now entertain a motion to adjourn.
So moved.
Second.
All right, a motion from Ms. Byers-Bailey, a second from everybody else, but we'll give it to Ms. Cheek. All in favor, let it be known by a show of hands. Any opposed? Oh,